behalf of the Novartis Foundation, the Global Fund, the McGovern Foundation, the Norskin House, JPIGO, Vilgrow Africa, and all the remarkable partners of the HealthTech Hub Africa, I'm delighted to kick off this third edition of the HealthTech Investors Summit in collaboration with the Africa HealthTech Summit of the Africa CDC. First, I wanted to extend a special thanks to the government of Rwanda for its unwavering support of the work of the HealthTech Hub Africa's work over the years. Your support has really been instrumental in our growth and in amplifying our impact and the support to entrepreneurs and governments alike. Additionally, we are very excited this year to be co-hosting our summit with the Africa CDC. It's really a testament to our collective commitment to strengthening the health tech ecosystem on the African continent. So thank you very much to the Africa CDC team and its organizers. I wanted also to extend a big thanks to our co-sponsors of this event. So Grand Challenge Canada, PATH, and BCG, thank you for co-hosting together with us. So the HealthTech Hub Africa was founded in 2021 with the singular vision to unite startups, governments, experts, and investors in a collaborative effort to support the growth and market readiness of innovative startups across the African continent. Our mission is clear. It is to build the capabilities of these startups and their teams and to foster a powerful network of skilled entrepreneurs at the Pan-African level. In the last 3 years, we've had the opportunity to support over 100 startups which have raised more than $18 million in funding and have impacted over 3 million lives and beneficiaries across the continent. The HealthTech Hub Africa also aims to create a platform for a meaningful dialogue to ensure startups are guided by government policies, processes, and priorities, and that governments can create enabling systems to support startups to thrive. And the last days that we had at the Policy Summit really showed us the benefit of such a dialogue and how needed and helpful it can be. We also understand that health tech is one of the most powerful tools we have to close the gap in healthcare delivery globally. It holds tremendous promise and potential, but yet we have big challenges that we are still facing. For example, how can we create enabling environments that allow for more of these innovation and solutions to scale? Over the next 2 days, we have an exciting agenda ahead of us and the opportunity to use our time together to rethink how we can bridge the gap between unveiling the launch of our Standards and Interoperability Lab, as well as hosting a pitch session where some of the incredible startups of the HealthTech Hub Africa will be presenting their solutions and their groundbreaking businesses. So you really will not want to miss that, and I hope that you can join tomorrow as well. So with great anticipation, I would now like to invite Honorable Minister Paula Ingabire from the Ministry of ICT of Rwanda to share her perspectives on health tech innovations, on financing and the role of government to scale and support startups on the Pan-African country. Thank you very much, and I really wish you a successful health tech summit. Thank you.
Good morning, everyone. Esteemed guests, I'm delighted to join you today for the 2024 HealthTech Investor Summit, an event that showcases talent, innovation, collaboration, and investment that is required to transform African communities. But before I get started with the main theme of why we're gathered here today, allow me to recognize various partners that have been instrumental in not just bringing this Investor Summit to life, but also in the different partnerships that we have. I think Novartis, we've already had some of the work that is being done with the HealthTech Africa Hub, the Global Fund as well, and McGovern, who have really been instrumental through the hub in supporting over 100 startups, providing them with resources and also creating pathways for scalable solutions. We also have GIZ, who has been our partner in really testing different proof of concept initiatives, and particularly within the healthcare industry. Africa CDC is our main partner for this conference and summit. Just about 2 days ago, we had a soft launch, and I think yesterday at the opening it was mentioned. We had a soft launch of the blueprint for digital healthcare transformation, and we're very excited about it because it allows us to align with the different both global and regional initiatives that are happening, but it also creates a template for governments and nations to work together in really ensuring that as we unlock the potential opportunities of having a One Health ecosystem across the continent, that can be made possible through the creation of such a blueprint. This year's theme, Innovating for Community Health, Resilience and Wellbeing, Unlocking the Power of AI and Emerging Technologies, holds immense promises for the future of healthcare. And I think most of you in the room will agree with me that delivering equitable and quality healthcare to all remains one of the most significant challenges of our time. However, emerging technologies such as AI, robotics, 3D printing, Internet of Medical Things, blockchain, virtual and augmented reality, and I can go on, offer us with so many opportunities to reimagine community healthcare delivery. Today, I want to reflect on 3 key themes, and I'm picking from the main theme that has brought us together here for these days. One is around the impact of emerging technologies, and particularly AI, on community healthcare, the challenges that we must address, and the partnerships that we need to unlock this potential. So AI is transforming how healthcare is conceptualized, delivered, and managed, particularly at the community level. We see the application of AI-powered tools making it possible to detect diseases early and more accurately, even in resource-constrained settings. We've seen examples of AI algorithms when applied to the mobile device or diagnostic tools, where we're able to detect conditions such as skin cancer, tuberculosis, and this has allowed us to scale medical expertise across the remote areas. AI systems are also used to analyze patterns using a vast data set to forecast disease outbreaks and predict health risks. And what this has allowed us is for communities to be better prepared, and also helping public health officials to act proactively rather than reactively. And that's the power of artificial intelligence. I know yesterday and today telemedicine has been highlighted. When we think about AI-driven telemedicine platforms that are connecting both healthcare providers with patients across different geographical boundaries, what we see is that we're able to expand access and care while at the same time reducing disparities. When we look at underserved areas, AI chatbots, virtual assistants are helping to answer medical questions, triage symptoms, and also provide follow-up care. Particularly in Rwanda, we've also been able to experiment with different AI applications on how we can support our community health workers who are the frontline healthcare providers within our ecosystem. And I think, as the Africa CDC DG mentioned yesterday, when we think about AI, it not only supplements healthcare, but it also empowers communities to take ownership of our health through the digital solutions, whether through education, advice, and preventive care. Now, much as we think about all of these opportunities, and this is just a summary of what is possible when we deploy AI solutions to address healthcare challenges today, we also know that the potential of AI, while it's undeniable, there are challenges that come with that we must be able to carefully navigate and respond to, and also to ensure that the way we deploy emerging technologies, and particularly AI, aligns with our vision for equity, inclusion, and privacy. Let me start with bridging the digital divide. When we even think about the number of people that remain unconnected globally, the majority of those are found on the African continent. But also, not all communities have the digital infrastructure that will allow them to benefit from a digital-first healthcare approach. And so whether it's limited access to internet, whether it's limited digital literacy skills, language barriers, all those are challenges that we need to collectively address to ensure that these technologies do not exacerbate these inequalities. While in Rwanda, we've made progress in making sure we connect all healthcare facilities with internet connectivity, we even had to make a particular effort in ensuring that for those healthcare facilities that are in remote areas, we can leverage some of the new solutions like Starlink to ensure that these healthcare facilities can have at least some basic form of connectivity to allow them to leverage technologies. And this is thanks to the partnerships that we've had with the Tony Blair Institute. The other challenge that we must address is around bias and fairness in AI algorithms. AI systems depend on data, but if the data is incomplete, if it's biased, then the solutions that we generate will in many ways have a lot of biases in them. And so it's critical that as we build all these AI algorithms that we ensure that they're inclusive and they're also representative of the communities that we are serving. One of the things that we've undertaken as the Ministry of ICT, the Ministry of Health, the Center for Fourth Industrial Revolution and the Gates Foundation is to build and train a large language model for decision support for community health workers. And starting with next year, we should be able to start testing it. And in testing it, we're able to see how we can minimize as much as possible these biases while also empowering our community healthcare workers. The third challenge, which I mentioned earlier on, is on data privacy and security. As you can imagine, health data is very sensitive, and trust is essential if we're deploying these digital technology solutions. AI solutions must operate within robust frameworks of data governance, protecting patient privacy, and also meeting some of the national and global data protection standards. When we do some stock taking, looking at the African continent, maybe 20 countries already have some data protection and privacy laws in place. And one of the conversations we've been having with the Africa CDC is bringing together the continent to have a framework that we can all align on that allows us to have standardized and harmonized data protection regulations and laws. Because if we start to think about cross-border data flows, if we start to think about unlocking health across borders, this will not be possible if we don't have the right regulatory processes and instruments in place that are harmonized. And also, because today we're talking about the Investor Summit, for many of the businesses that are in the healthcare space, it won't make sense to navigate 54 different regulations or legislation as you try to expand to the different markets to create impact with the solutions that you have developed. So navigating these challenges requires that we place people at the center of these AI innovations. Communities, particularly vulnerable ones, must be partners in both the design and development of these solutions and not just beneficiaries. Now, collaboration is going to be very critical at every stage, whether it's public-private partnerships where we see governments working with tech companies to co-create these AI solutions or any kind of digital solution for healthcare, but also ensuring that it aligns with some of the national health priorities. But even as we think about collaboration, it's also how we invest in local talent. And I think that's the theme for today's morning session, really thinking about how we build a pipeline of startups, of innovators, of entrepreneurs, healthcare professionals that are really going to develop homegrown solutions that are sustainable and relevant to the challenges that we're solving for. And of course, as we do this as a continent, as nations, we must also know that we are operating in a global landscape. And so sharing best practices, learning from different countries, but also collaborating with multilateral organizations is very helpful in making sure that we have the right solutions and the right partnerships that can allow for scale to happen. So let's imagine for a second a future where community health workers are equipped with AI-powered mobile devices that enable them to provide diagnostic services in some of the remote areas of the different countries we're coming from. A future where governments can predict disease outbreaks weeks in advance or even months in advance through the different tools and AI analytics systems that we'll be able to have deployed. A future where every citizen, regardless of location and socioeconomic status, has access to quality healthcare, and not just quality healthcare, affordable healthcare, powered by AI and the various emerging technologies. This future is within our reach if we embrace the innovation boldly, but also responsibly, while ensuring that technology serves as a tool for empowerment and not exclusion. In closing, let me emphasize that emerging technologies, AI and all, it's not just about the technology, it's about the people. It's about improving lives, it's about fostering well-being, and it's about building resilient health systems that leave no one behind. But innovation alone will not suffice. We'll need political will, we'll need community involvement, we'll need collective action to unlock the power of these emerging technologies to ensure that we deliver sustainable community healthcare. And so I'm hopeful that today's Investor Summit presents us with the invaluable opportunity not just to match the groundbreaking innovations with the finance that is needed to scale, but also to provide these innovators with the resources, the ability, not just financial resources, to test and deploy their solutions. And that is why Rwanda has positioned itself as a proof of concept hub. We welcome most of the innovators and startups in our midst here to really consider Rwanda as a place where you can test your solutions and where we will walk the journey with you in ensuring that you can scale them beyond Rwanda. And so together we have the opportunity to create a healthcare system that is inclusive, accessible, equitable, a system that leverages the best of technology to meet the needs of every individual and every community. So as I wind up, let us commit ourselves to this shared vision and let us act with urgency, creativity, and purpose. I thank you.
Thank you so much, Honorable Minister, for delivering such a powerful message to remind us about the purpose, to think about the future, and to reflect on our role, not only from an investment perspective, also the support and regulations and capacity building. So with those remarks, we would like to now understand where are we now? What's the current context in terms of supporting health tech solutions? What are we missing? What is the potential? With that, I will invite our colleague Emmanuel, our advisory lead at Virgo Africa, to make a presentation. Thank you.
Thank you, Olivier. Let me use this. Good morning. Thank you. It's a great pleasure to be seated amongst all of you because I know you care about healthcare as much as I do. And I believe that you're here because somehow you want to change the status quo, or you're interested in seeing that our healthcare state across the entire continent is improved. And so I hope throughout my presentation I can speak to you and perhaps show you why you need to invest more in healthcare. My name is Emmanuel Momanyi, as Olivia said. I am the advisory services lead at Virgo Africa. And to talk about impact, in so many ways, the Honorable Minister has actually sort of set the stage for my presentation. And I actually just want to change the flow of that. Allow me to begin with this slide. That's a photo of me. I don't know whether you can see me at the corner. This was during a visit that we did to one of the companies that we support called SOIC, or SWAC as they call it, in the Democratic Republic of Congo. And this is Bangombe Health Center. You can see a lot of children behind there because this was during a vaccination drive, if I remember correctly. And Bangombe Health Center is about a few kilometers, 20 kilometers or so out of Kenge town, located in Kwango province. What is interesting and what you might not know in this photo is, I just want you to look at the window. Behind that window is a cesarean section that was going on. This hospital does not have electricity. And so they opened the curtains, actually asked a bunch of us that were standing by the window to let light in so that the surgical team could use that light to do that cesarean section. Well, that sounds crude, right? But I'm not sharing this to shame or sort of show how bad the state of healthcare is. But I want to show you, and I really hope that you can sort of see why we need health tech solutions. The cesarean section was an emergency. A mother's life and a young baby girl was saved that day. You know what helped or what enabled that? A device that was provided by SOIC. SOIC provides ultrasounds, and which they equip facilities with and provide also to community healthcare workers. But they don't just give ultrasounds, and these are actually portable ultrasounds that you can use the smartphone. They provide a smartphone as well, and they created an EMR application that would store patient data. It will interest you to know that Kenge Referral Hospital, which is like the provincial hospital in the entire Kwango province, that does not also have electricity. In fact, that town, we had to shower with cold water in the hotel room that we stayed in. But that's far from the point, because they were able now to have working ultrasound machines, because before then, they only had one that was working in that referral hospital, and all the surrounding facilities did not have ultrasounds. And I'm sharing this so that you see the power that health tech has, and why we actually need to support health tech solutions more. Let me go back to my presentation. In the past 5 years, we've had about $700 million raised. And, a lot of startups in the healthcare space have raised money, a lot haven't. But you will notice if you look through the numbers, most investments, settled or were in these five major markets. We have South Africa, Nigeria, Kenya, Egypt, and Ghana. And you will see different deals, the different number of deals across those markets. But what is most important here is that all these startups cumulatively raised 700 million. Of course, it includes startups that are not in those 5 countries. But as you can see, almost 50% of that was actually from these 5 major countries. And you look at $700 million and think, perhaps that's a lot of money, right? Wait until you compare that to other sectors. Look at fintech. Startups in fintech raised almost 10 times, actually more than 10 times, what healthcare startups raised within the same period, between 2019 and 2023. Yet we have a lot of problems within the healthcare space. For example, we have a growing population and a very high disease burden. Our cost of healthcare is high, and our population is not able to actually afford that. Our doctor-to-patient ratio could also do with some work, right? And yet, the investment that we have in healthcare is quite low. It's arguably low. I mean, someone else would think perhaps it's high, but I would want to argue that it's actually low because of some of the challenges that we have. We cannot solve all those 3 major challenges using the same traditional methods that we've been having. Perhaps this is where health tech can actually help improve the status quo. And we have a few things that work for us. For example, a high penetration of smartphones in Africa. And all this necessitate the need for health tech solutions to be rolled out. And it sounds all rosy, perhaps I'm sounding as though I'm convincing all of you to go in there, but there are several risks that you need to keep in mind. Healthcare as a sector has a lot of regulatory and compliance challenges. It's such a nightmare for healthcare startups to navigate the complex regulatory frameworks, especially when they're trying to scale outside their markets. And our infrastructure could do with some work as well. For example, not every household in Africa has electricity, and not everybody has a reliable internet. And these are some of the infrastructure that we need to enable health tech solutions. And what I think is the elephant in the room is the long investment cycles. As investors, of course, you know that you perhaps need to be very patient. Healthcare is not one sector that you get in and perhaps see your returns as fast as fintech. Maybe that's why we see the difference in the investments across those sectors. So you will need to be patient because, again, there's a lot of clinical studies that need to go into it, a lot of time that is taken to do product development. But it's not all gloomy because rewards can be realized as well. Healthcare has, as a sector in itself is growing, and the health tech startups have some really great momentum to keep going. And it provides an opportunity for dual impact. You get impact, financial impact, and social returns. And we've seen this in so many success stories. Success stories of exits and really great mergers and acquisitions. And that in itself illustrates the importance or the strong exit pathways or potential high returns that you have down the road. And I'd just like to highlight a few examples. Helium Health, who is a current portfolio company of the HealthTech Hub, acquired Medi, doctor booking platform, back in 2021. And M-Pharma from Ghana acquired the majority stake in Health Plus, and I believe Health Plus is one of the largest pharmacy chains in Nigeria. And BioNTech last year, in 2023, acquired InstaDeep for a whopping $682 million. That is perhaps more than what was raised by startups in the 5 years. And so that is some of the benefits that some of the big returns that you can stand to gain as an investor in putting money into this sector. And it doesn't end there. You will notice that all these highlighted examples somehow went through an incubation program or an acceleration program. And it is important that we also support entrepreneur support organizations like HealthTech Hub Africa, Vilgro Africa, who are all working together to support healthcare entrepreneurs. And I would like to show you an example of why it is important to catalyze innovation by showing you this example of Benacare. Benacare is an alumni of the HealthTech Hub, and they received funding from Vilgro Africa, which was made available by the IDRC. And they used that funding to conduct a study on the different treatment options for CKD, chronic kidney disease. And the result of that, or the findings of that study, were used, of course, they did generate evidence, but they used that to engage government, and those findings were actually used to change policy. Currently, the National Health Insurance Fund of Kenya, which is now called SHIF, is actually going to reimburse for peritoneal dialysis as a result of the work that was done by Benacare. And not just that, they actually went out and rolled out a new solution of mobile dialysis. And I'm pleased to announce that they did secure funding to roll out that mobile dialysis. And that is the power of supporting or catalyzing innovation. They get to change the status quo. They get to generate evidence that then comes up to change policy, but also provide new solutions that can support or help provide care, care that is accessible to all, affordable, and quality. As you can see, Benacare has served about 15,000 patients. They've generated about $1.4 million and contracted about 11,000 clinicians and have trained more than 1,500 caregivers. And so, like I began by saying, that I want to speak to you. I hope I've spoken to you, and I hope you can see why you perhaps need to invest more in healthcare. Thank you so much, Olivia.
Thank you so much, Emmanuel, for such a powerful presentation. Personally, I've learned a lot, and that's exactly what we're going to be discussing. There is need, so there is demand on the ground. It's clear that healthcare is one of the priorities for our continent, and there is potential for scalability. Second, there is need for more market-driven solutions to ensure that we can be able to meet the growing need for healthcare solutions. 3, there is investment. Emmanuel just outlined how some other sectors like fintech are 10 times more than health tech. Means there is funding around, just it's not enough in health tech. So with that, we're going to transition to the next session to discuss why. Why do we have that gap? Why do we have those barriers? What are we observing in terms of promoting investments, more investment in health tech solutions? And with that, I'm going to invite some of our panelists who are going to be with us to discuss those questions. First on my list is Sarah Desrosiers, Director of Health Equity at the Novartis Foundation. As I invite her to join us on the stage, Sarah, in her role as the Director of Health Equity at the Novartis Foundation, is responsible for establishing global health partnerships on health equity, health tech, and data, including overseeing the Health Tech Hub Africa in Kigali. In doing so, she works closely with governments, UN organizations, implementing partners, innovation players to establish value-added collaborations on CVDs and beyond, with the mission to accelerate health tech innovations in public health systems for improved population health outcomes. As a public health practitioner, she worked across public and private global health organizations such as WHO, UNAIDS, CHAI, and others, developing an expertise on access to medicines, infectious diseases, and NCDs. Prior to joining the Novartis Foundation, Sarah worked as a management consultant for many years in the global health and pharma sectors, focusing on impact evaluation, go-to-market strategies, and digital transformations. Welcome, Sarah, to the stage. Next on my list is Carl Furi. He is the director, the deputy director of digital services at the Center for Digital and Data Excellence at PATH. Carl is a prominent figure in global health, global digital health, currently serving as a deputy director of digital technical services at Digital Square, a PATH-led initiative that aims to support digital health solutions globally. His role centers on advancing digital health interoperability, health systems, strengthening and deployment of digital tools in low-resource settings. With a background in technical advisory, Carl has contributed significantly to initiatives such as Open HIE, Open Health Information Exchange, focusing on scaling health information systems and ensuring data exchange capabilities in support of universal health coverage goals. Welcome to the stage, Carl. Last but not least, we have Pulkit, Pulkit Agarwal, I hope I pronounce your name quite well, portfolio manager at Grand Challenges Canada. Pulkit is a portfolio manager at Grand Challenges Canada Global Health Innovation Team, focusing on investment due diligence, funding and negotiations, and supporting innovators in low-resource settings. With a background in management, consulting, and health, he has worked internationally across various organizations, previous roles including consulting with Salient and serving as a program manager at India Health Fund. Welcome at the stage, Carl. Pulkit. And I also want to ensure that you are aware that after this session, we have a fireside chat, so please don't miss it after that. Great. So thank you so much for joining us. Before maybe we jump into the discussion, I would like you to take a few seconds, introduce yourself, and get people to know what you're doing a bit. Starting with you, Sarah.
So hello, everyone. I'm Sarah Desrosiers, Director of Health Equity at the Novartis Foundation. So at the Novartis Foundation, we are a non-for-profit organization that supports the acceleration of health tech innovations in healthcare delivery, in particular in the area of cardiovascular diseases. So we very much believe in the power of data to predict and also prevent diseases and illnesses, and the powerful work that, the powerful benefits of health tech innovations in really transforming and reimagining how we deliver healthcare on the African continent and beyond.
Thank you. Carl?
Thanks. It's a real privilege to be amongst the giants in the room today. So I'm Carl Furry. I'm the Deputy Director of Technical Services at CODE, the Center for Digital Data Excellence at PATH. And for the last 5 years, I've also been deeply involved in looking at the global goods community under the Digital Square Initiative, which has been looking at how do you put the right information in the right people's hands to make the right decision. Trying to bring together a marketplace to promote digital tools in the public sector. And a lot of that's around information, having the right capacity and tools. And I'm passionate about looking at good business models for open source solutions and how we make a difference in this world.
Great. Pulkit?
Hello, everyone. Good morning. My name is Pulkit Agarwal. I'm a portfolio manager with Grand Challenges Canada. We are based in Toronto. I oversee a lot of our digital health investments that we make at Grand Challenges Canada, but maybe very briefly about Grand Challenges Canada. We are an impact funder that fund early-stage health tech innovators in low and middle-income countries. Over the last 15 years, we've invested in about 1,500 innovations, and about 60% of them are locally led. And 300 of the 1,500 are actually transitioning to scale. So pleasure to be here and looking forward to our conversation.
Great, thanks. So before I jump into the conversation, if you have any question or if you needed to address any point that the speakers will be making, please scan the code here, raise your question or comment. We'll be able to address it in the last 10 minutes of the session. So maybe before we jump into the deep discussion, Pulkit, you've been working with a lot of startups as a portfolio manager. Why are investors attracted to the health tech? Why we've seen that that health tech is not necessarily the best, I mean the biggest in terms of raising funds. Why are some investors like GCC attracted to the health tech sector?
Thank you for that question, Olivia. So over the past few years, we've invested a lot in the digital health tools and technologies. One example that I want to share and bring to light is Touch Health's M-Mama. So it's basically an emergency management transport system that is scaled in Tanzania. They have about 5,000 community drivers on their roster that is serving a catchment area of almost 65 million people. And as of mid-2024, they were able to, through the use of their platform, they were able to complete their 100,000 emergency transport. So that's the impact that we are able to create in terms of bringing health access to people where there's most needed. But we are also trying to balance that. At GCC, we try to balance risk and reward. So we underwrite the risk in investing in innovations when there is high potential for getting social return. So social return can be in the form of lives saved, lives improved, jobs created, policies influenced, and so on. I mean, at the forum here, we have been talking a lot about the challenges related to scaling of health tech innovations. But I think I do want to focus and emphasize on two specific points, which I come across as part of my work through my vantage point. One is that at GCC, when we invest $1 in any innovator, we ask that innovator to raise another $1 from another source. So we look for match funding. Now, at a portfolio level, we've seen that there is 1:1 match available in digital health innovations. But when we scrutinize the funders, the investors that are funding these portfolio companies, we see a lot of fragmentation. So there's maybe 40, maybe 45 of those investors that are contributing ticket sizes of about 100,000 Canadian dollars, which demonstrates that there's a need for a lot of consolidation. There's a need for a lot of collaboration. And there's need for a lot of aligning of due diligence processes, et cetera, to reduce the burden on innovators. But on the other hand, we've also realized that there's a lot of mismatch between supply of innovations and demand for innovations. And there's a lot of burden or transactional cost that the innovators have to take to be able to scale through the public sector. So there's a lot of time that they have to consume, a lot of resources that they have to commit. Now, from GCC's perspective, we are trying to solve these kinds of problems through various mechanisms, various tools that we have at our disposal. One of the initiatives that has been launched, and we were having a roundtable discussion yesterday, is the Investor Working Group. So that might be an avenue to coordinate investments in some of the most promising health tech innovations. But also like one-on-one conversations that we have with our partner investors and funders is something that we look forward to doing more. But on the other hand, we are also, like for the problem related to mismatch between supply of innovations and demand, we are also working with county governments in Kenya to help them articulate demand. So we are implementing the mountain model, which some of you might be familiar with, and essentially helping them with like articulating the demand, what problems that they face, what are some of the innovations that they could possibly inject and integrate into their public health system. So we are doing and supporting them to help build that capacity. And then we are also launching some grand challenges locally in some of the countries. So we've done that in Senegal, we've done that in Ghana, essentially to create innovation desks within those country ecosystems. And then not just that, we are also doing some market shaping work in terms of aggregating or garnering interest of domestic and international donors and funders. So I can share 3 examples. Global Health Innovation Fund was set up almost 12 years back, and that has yielded multiple like financial returns as well as social returns. I think the funding in those, the portfolio companies that GHIF made has benefited almost 250 million plus people. And then more recently, Cross-Border Impact Ventures is another Canadian investment fund that is women-led and focuses on women's health. And then an example from more recent times is the Transform Health Fund, which has been able to raise almost more than $100 million. Again, the hypothesis here is that as we fund some of these funds, they will be able to garner the interest of private capital players as well as other institutional donors. And then fund managers will also be interested in funding some of the portfolio companies that we've funded. So I think that's the hypothesis, and hopefully that will stimulate both the health tech ecosystem as well as garner the interest of various funders, institutional and otherwise, to be part of the growth story of the Africa health tech ecosystem.
Great. Thanks, Pulkit. That's very interesting, like this kind of multi-stakeholder collaboration to raise more funding. And now I want to jump to Sarah about the need, because we've seen there is some sort of lack of balance between innovators and investors. There is surge of technological innovations in health, but the funding is still not enough. So how do you bridge the gap? What are the tactics and measures we should take, to ensure that we kind of bring a balance in the ecosystem?
Yeah, absolutely. So for us at the Novartis Foundation, we've been initially very interested to establish a platform that allows to bring together investors, experts, innovators, all together around the same table so that there's opportunities for alignment and better understanding of the needs. And so that's where our initial funding has gone into, to sort of bridge this gap in communication and ensure alignment of priorities and interests. This is a big element of the work that the HealthTech Hub has been doing over the last years. And where the Novartis Foundation has come in as well as has been in the provision of bridge capital. So we've been interested in supporting startups to see how they can implement their solutions, particularly in the public health systems. So this has been through innovation challenges. We've launched innovation challenges and have been providing grant money to these startups so that they can implement specific projects that are really relevant to the government of their countries. We are, however, very well aware that there's a variety of different types of funding out there, and that grant funding is very much project focused, and so focuses on milestones that that startups are implementing, and that it may not be taking them longer or beyond the timeline of that project. So we are now really thinking about other ways, other sustainable ways of pooling, funding together, looking at different types of investors, donors, local banks, private sector, larger development agencies that would be interesting to pool together funding so that startups are enabled with longer-term funding that can support them to look at their strategic growth. Yeah.
Great, thanks, Sarah. So on that point, one of the topics that, at least in my experience at the HealthTech Hub, we've been dealing with before we address topic of investment is partnerships, especially government partnerships, because majority of healthcare sector in Africa is public health. So we've been dealing with this topic, how do we get more solutions into the public sector? And I think that's something that Carl has been doing for quite a while. So what are the key drivers? What does it take? Because investors are asking this kind of partnerships. What's your experience with that?
It's hard. Let's just start with the reality. I think there are a few key things that we often overlook. Sometimes technologists are sold the dream of build it and they will come. Doesn't work here. I think key things, and the Honourable Minister mentioned a few of them, and I think I just want to reiterate them, is partnerships from the start. Know your client. Understand what the problem is that you're solving and make sure it's a real need. And get government buy-in, get leadership buy-in, and collaborate along the way. Because this isn't something that often generates a good result by just presenting a finished product. There is an ownership that happens when you bring teams along with you, and often there are complexities you don't understand until you've been in the game long enough. I had the privilege of setting up breakfast this morning with some of the innovators in the field and just challenging ourselves and saying, how much do our partners and investors understand the health system we're trying to make a difference in? Now, and really struck a nerve of saying we need to bring people closer. So make sure you're partnering from the get-go. I think, and also when you're looking at your tool, understand what your outcome is. Your impact and the sustainability of that impact is something you need to really make sure you're talking to and having that particular buy-in. Are you able to make a difference? What is the difference you're making? Is it needed? Is it prioritized at this stage? So these are some of the key things that you need to be thinking around. And was also mentioned earlier, there's the boon that we're seeing Africa CDC and the government's working towards to try harmonize a bit of the regulatory frameworks. This is health data. It's not financial data that's just money that you can make more of. This is life. And these are people's lives. These are our children. These are our kids' data that we've got in it. So the regulations exist for a reason. I think that's a challenge for many entrepreneurs who are starting up, is you need to make that effort to understand the space in which you're working. Why is it a challenge to host your systems outside of the country? How are you dealing with the uptick of some of the new startup technologies and the SaaS instances? How does this play into your business model? So these are important things to make sure you're understanding to go through it. And then also, I mentioned it a bit, but I want to call it out explicitly, the security aspect of it. We're having the privilege now as Digital Square and Code to start scratching at this a little bit more. Data protection, cybersecurity, we've seen huge explosions of attacks in the health sector around this. There's an Ernst & Young report that a patient record can be as valuable from £100 to £1,500, depending what the data is in it. We have a responsibility of looking after that data, and it starts by thinking about where does security fit in my tool, my innovation, and making sure you're presenting that as an option so that governments and investors understand that, yes, you're here for the long term, not just a quick option.
Great. Thanks, Carl. So since we are privileged to have the minister in the room, there is an interesting question coming from the audience, and I've seen a lot of votes on it, so that's why I'm addressing it. Someone is asking, how does digitalizing the healthcare sector in Africa affect the rural communities without electricity or internet access? So someone would like to get your take on that, Honorable Minister.
Thank you very much. And that's a very good question, but I think when we are looking at some of the digitalization programs, we don't look just at the digital components, but we look at what else can we do to ensure that uptake can happen. I think earlier in my remarks, I gave an example of about 40 healthcare facilities in rural parts of our country where, because we couldn't connect them to fiber connectivity, there was still lack of electricity infrastructure. One of the solutions that we went with was a bundled solution of having Starlink with solar panels. And so when you're thinking about all of these digitalization problems or programs that you're implementing, context is important. And so what we started with was to say, okay, our ambition is to digitalize all healthcare facilities. a mapping on what kind of infrastructure exists, and that meant where we have electricity, it's easy to pull the fiber. Where we don't have electricity, we're thinking about a combination of Starlink and solar panels to help power both the internet and electrification needs that those health facilities have. And that's a similar approach that we've taken for schools as well. Now, that's not just infrastructure. We also know that we could have great infrastructure, but if people are not trained and they don't have the right tools, devices, and systems, then you just have good infrastructure that is not being put to use. And so we have a multi-pronged approach to how we do this. We don't just look at the infrastructure side, we also figure out what kind of systems and tools will these healthcare or community workers need, and how can we train them so that they have the basic digital literacy skills needed for them to use these tools to deliver better healthcare services leveraging technology. And I think these are examples that we can see in different countries where you don't just wait until you have electricity in a particular part of your country, especially for the remote areas, but you figure out what could be the alternative of delivering this kind of infrastructure and leveraging different solutions, solar technologies, renewable energy, Starlink connectivity to just ensure that at least no particular community is left behind. And obviously, when we talk about this, you also have to think about the funding of this and what the sustainability looks like. And so essentially, Rwanda's electrification rate is now over 74%, which means that over time, as we close the electrification gap, we will then also sunset some of these solar solutions if they're not, and then connect these healthcare facilities and schools and different other households in those areas to high-speed broadband connectivity. But in the meantime, they have an alternative solution that they can use to ensure that they are not left behind.
Thank you so much. That's very, impactful. So coming back to Toolkit, someone is asking, I guess maybe it's an innovator, what are the step-by-step? Because it looks like it might be rocket science to raise funding these days. So what are the step-by-step processes to get successful funding?
Yeah, I think that's a very good question. I think one of the key things which I would recommend is just start speaking with the investor or the funder. Try to understand and align with their investment thesis, because each investor would have their own investment thesis, their own motivations, and own way of understanding what part of the innovation they're able to fund, right? So that is very key. Start getting in early conversations with investors and try to iterate on your story. I think that is also very important. Sometimes you focus on some parts of your story, which even though are important, might not be able to capture the real impact of the work that you're doing. So I think it's very important to continue to iterate and speak with the investor to align and see where there might be a good fit. But I think it's challenging, and I can totally empathize with innovators, because oftentimes it feels like you're knocking your head against a wall. But I think the key to it is like be resilient, continue to work with the innovator. I think the innovator also appreciates all of the effort and time and resource you're putting in. But I think it's a collaborative process and something that you should try to make it more collaborative as opposed to just blanketly applying to RFPs.
Great, thanks. That's really useful. So maybe as we wrap up this session, I would like to get everyone of you your take on what. Because we kept talking about this collaborative efforts, inclusivity, collaboration, all this. How do we do it? What are the actions should we take moving forward as an ecosystem? I would like to get in 1 minute each. What are the concrete actions you foresee as taking moving forward so that next year or 5 years down the road, we don't keep talking about the same challenges? Yeah, maybe you can start. Yeah.
So I think there's really critical value in innovators really aligning and understanding the government priorities and the needs in their countries. And so I think there's huge value in co-designing solutions with governments, but also with other partners, so that solutions are really fitted to the needs, especially when the government is the one procuring those solutions, or the innovator wants to expand in the public health system. And I think accelerators like the HealthTech Hub Africa and other incubators also can really provide this platform for discussion and dialogue. And I think there's also a real benefit in trying and testing those solutions very early to also make sure that we're not implementing them full scale. We are iterating. There's room to fail also, and to adjust the solutions to really the needs. But that would be my conclusion.
Great. Carl?
1 minute, that's a great amount of time. So I'm looking at it from a public sector perspective, and I think there are a few things for us to be looking at. A lot of the investors now have a very big focus, and I'm thinking the donor organizations have a focus on localization. Are you in the situation where the work is happening? And I think as innovators, you need to start celebrating that. And also understand that often donor investments, those dollars can be very expensive. $1 isn't easily used. There's a lot of rules around it. So figure out how you work with that. But there's a space and there's a market there. Find your implementing partners who've been through the space and work out how you partner with them. And I'll come back to something that you said, like be clear on your value proposition. Be able to explain it to your grandmother. And if you can get it that clear, you're probably going to make it clear in the proposals too. So I think that's quite important. And then the other side, just a slightly different tack, what you were saying, I think we also want to be cautious of over-pilotitis. The public sector doesn't have that much resources compared to some of the other private sector spaces. So be careful about overly trying to fail too quickly. If you're going to do it in a controlled space. But we don't want to see a death by 1,000 cuts of different systems coming up and failing, because it's going to put strain on the system that you've needed to build capacity around. So find a good medium and work with that, because there is a space to figure out what works and do that with your partner and align to those country priorities.
Yes, good.
I completely echo with what Carl and Sarah was saying, but I just do want to emphasize from a funder perspective, I think we need to create more avenues to deploy patient capital, because we've realized through experiments and investments that the pathway to scale is not linear. And we need to be able to provide different types of financing instruments so that innovators can really test and validate their business model, their approaches to scale, and things like pricing strategies. It takes time. These are things that shouldn't be forced on innovators to be completed in like an 18-month time period or a 24-month time period. So we need to be really patient to help innovators work out all of these things so that they can create the lasting impact that they're intended to create.
Great. Yes, I do agree. I think this quality capacity building is very important, because capacity building is quite at the core of everything. Plus, I think what Sarah mentions, more collaboration and more alignments with stakeholders, because this is not a one-man show. It has to be something that all of us can only win if I can only win if all of us win. Same with also what Carl mentioned about strengthening our ties with the ecosystem. So with that, I would like to thank all our panelists for sharing their insights with the audience as they go back to their seats. And we would like to now hear from, please take your seats. We'd like to hear from we would like to hear from the actual people who are doing it. So we'd like to hear from the investor and the startup. So with that, I would like to invite Mr. Takashi to take a seat and moderate the next session. Thank you.
Hi everyone, how are you? Great, it's weird sitting on my own here, facing these 300 people, but it's full house, amazing. Previous speakers set the great context and surfaced the key questions for us. And Olivier asked this question of how do we do? Then my simple answer is, okay, let's ask somebody who's actually done it. So we would like to invite like two distinguished guests or colleagues who actually made something very important happen on this continent. And we want to have a more focused, intimate chat with them so we can have some tangible takeaway from this session. My name is Takeshi. I'm from the Boston Consulting Group based in Nairobi. I've been living in Africa over the past 15 years or so in Kenya, South Africa, and also Tanzania. Then I witnessed the very strong traction and growth of health tech or health venture growth, especially since the outbreak of COVID-19. Okay. Then, as Emmanuel said, picture is not just rosy. There is a risk, there is a challenges for health ventures in Africa, including regulatory part, ability to pay, and so forth, so forth. Then, together with Bill Glow, BCG had a privilege to support almost 40 health ventures over the past 4 years under the acceleration program called Homegrown Solutions Accelerator by African Union Initiative. So I'm always wondering how investors and ventures can team very effectively to amplify the impact and also the commercial traction on this continent. So this is a question we are trying to ask to these two distinguished speakers. So now I'm inviting the speakers. First speaker or first colleague, Jim from Helium Health. Jim, please. Okay. And second colleague, Hiroki from AIC, please. Okay, great. So this team, representing these two iconic players in the African health tech ecosystem, has made something exceptional happen over the past probably 6-7 years. Of course, your journey must have been like a bumpy journey, but inclusive of that bumpy part, we are very curious to learn from you through this candid, intimate discussion. So if it's okay, I'd like to first invite Hiroki to talk about like investors' perspective. I guess AIC is probably one of the leading VC firm on this continent with a strong focus in healthcare or health ventures. So tell us about how you assess companies, what sets aside successful or not so successful ventures on this continent, please.
Thank you very much, Takeshi, for the question. Good morning. My name is Hiroki, from the director of AIC Kenya. I've been in Nairobi since 2015, only 10 years. But since then, we as an AIC, we are doing investment primarily in the healthcare sector in Africa. Currently, we manage 2 funds, and in total, we manage 87 million USD, and we have over 50 portfolio companies across this continent, including North Africa, also Francophone Africa. Yesterday, some of our friends from Guinea was saying, are you doing investment in Africa? So also we are ignoring those also areas, Pan-Africa. Then get back to your question, Takeshi. It's quite difficult to say like, successful how we analyze opportunities. But recently, we have one clear idea, which is the healthcare sector in Africa is very complex, also vary by country, And I think nobody has no objections. So sometimes one solution doesn't solve the problem. So we need to think about how we can solve the multiple solutions. For example, there's a company who provide very nice teleconsultation services, but maybe people cannot pay for that services. And then they can create a subscription model. But then maybe people say, okay, I need access to the pharmaceuticals. I need access to lab, those kind of things. And then I'd like to pick some examples from our portfolio companies. And also, Helm Health is one of our portfolio companies, but I don't pick that example because Jean is here today. And the company is, say, Reliance Health in Nigeria. which has raised like 40 million USD in 2022. And it's difficult to say like, which is successful or not, but which is one fact that they have reached some level of business. And another example is Bima doing business in Ghana and Tanzania, and they became profitable at global level. Also, they have business in 4 countries in Asia, and their target is different, but by that, they are providing 2 solutions. Number one, medical health plus telemedicine healthcare service provider. Reliance case, actually they started a business providing the telemedicine services, but at that time there are so many companies providing telemedicine, but it didn't work well. And then they introduced a subscription model, but the same things, the patient was not able to pay for that. Then they decide to provide working on more fundamental issues, how they can support the whole patient journey. Then they became an insurer in providing selling insurance and plus providing service using the telemedicine. Also, Bima's case, also they provide both, but their price is quite affordable, like $2 per month, only $2. How they can be profitable? The key is that they are using telemedicine. It's mandate for the customers to make a call before they visit the facilities. And then it reduces the cost dramatically. So technology can make it happen. In addition, in those countries, Ghana, Tanzania, mobile money does work well. So also the company can deduct $2 to $3 every month. Let's say in the end of the month, 9 a.m., 12 noon, 3 p.m., deduct $2 without calling, without any manual operations. So it reduces the cost dramatically. So in these cases, one solution sometimes doesn't work, but combination of several services product can solve those kinds of issues. So now, as ARC, we are always keen to see how their core solutions is fundamental, or critical for the patient or customers. And then, if so, and how they can add more service in the future. So that's kind of the maybe major we utilize. And as today also, Helm Health announced a partnership with another startup company. Also, as we see in the presentation, also sometimes startup can acquire other companies to be, work together. Thank you.
Thank you, Hiroki. Very interesting how you pivot and diversify your offerings depending on the specific challenges in Africa, including like ability to pay, yes. quite low. So Jean, your solution, like if I first heard about the type of your solution, like probably 7-8 years ago, I probably would have said, well, Health OS, forget about it. I mean, there's so many global solutions there. It's gonna conquer African continent. There's no point of building OS in Africa. But you nicely proved that Made in Africa solution actually works, even in this tough, low ability to pay market. So tell us how you made it happen, how you interacted with investors, and get their attention, made things happen.
Thank you so much. It's an absolute pleasure to be here. So I'll start with an introduction to Helium Health for those who aren't familiar with us. Helium Health is a digital health company. We are headquartered out of Nigeria, but we have presence across East Africa, West Africa, and the GCC, not Grand Challenges Canada, but UAE and Qatar. And we're really accelerating Africa's transition to being a tech and data-driven healthcare sector. And we do that in 4 main ways, one of which you've talked about. So our healthcare provider management suite, where we're able to provide electronic health records, telemedicine, appointment booking, everything that you need at a facility level and beyond. And I'll talk a little bit about more how we do this. And our second way in which we innovate is through our healthcare financing. How do you pay for all these things? How do facilities afford these things? So during COVID, we launched a product called Helium Credit. And Africa has a healthcare financing deficit of $66 billion, which is massive. So we're trying to do a little bit to bridge that gap. And to date, we've been able to lend $10 million to about 300 facilities across Nigeria. And the third way in which we do this is through public health solutions. And it's really great to hear the questions that are being asked. How do you digitize in rural solutions? As Hiroki has mentioned, we're here with one of our partners, so delighted to announce that we have partnered with Signalytic. Great invention where you're able to power solutions, providing connectivity, providing internet power in rural facilities. And so we'll be deploying to 55 facilities in 3 states in Nigeria through the partnership that's been made available with Signalytic. And the fourth way, which the Honorable Minister references, through data and analytics. So you have all these solutions, you have all this data, but what does that actually mean? So being able to infuse AI, doing predictive analytics, and then provide solutions, surfacing actionable insights to key decision makers, so at facility level, at county levels, at national levels. So that's a little bit of a whistle-stop tour about who we are, what we do. Carl, I hope my grandmother would have understood that. But yes, that's what we do. And to speak to our journey, so we did start at about 8 years ago. Helium was founded in 2016. And then in 2017, we applied for Y Combinator, and we got in. And I think the challenge there is just do it. You're new, you're fresh, but we applied, we got in, and that really was the launch pad. That really opened up doors for us. We were able to then do our seed round, $2 million, which then enabled us to do strategic acquisitions. We were able to scale across Nigeria. We were able to do our first public sector contract and sign that. And then that opened doors. In 2020, we then met with AIC. In the midst of COVID, we actually were able to close our Series A. So we were able to raise $10 million with AIC and Global Ventures being our main funders. And I think, just pausing and thinking through what helped us scale, you heard Emmanuel reference the fact that we were able to do an acquisition. So part of that funding went towards that. We were able to expand into the GCC region, able to expand into East Africa, and having partners like AIC, and I'm not saying this just because Hiroki's on stage, when we were launching in East Africa, he literally was on calls with me, Jean, meet this person, here's this person, are you going for this event? Literal hand holding. Because yes, it's great to get cash, but actually having someone who's invested in your growth, invested in seeing you growing and scaling, pushing up those networks, opening up those doors. And that's really what our partnership has enabled us to do. And so last year, we were then able to close our Series B. We were able to raise $30 million, again, with AIC and other investors. And the great thing about that was that, partners like AIC were then able to open up new customers to us, new investors, and new partners. So really having investors that understand the market as well. You don't want to work with people who have unrealistic expectations, by year 2, 7x and all of this, and it's undue pressure on you and the team. So investors that get it, investors that hold your hand and walk with you, and investors that are committed to even seeing you grow. So that's been our journey.
Thank you so much. I think we have a bit of time still remaining, so I will ask both of you this one question. So, in a word or two, how do you describe most important success factor for effective partnership between investors and ventures? And you can talk about how you actually did that in this specific partnership. Hiroki, may I?
Thanks. And investors has different characters, also strongness, and then sometimes we support the fundraising, also support the developing the business models. But I think I'd like to mention one thing is how support the non-organic growth in the future. Also look at from GCG also mentioned the consolidation in the last panel. And I believe in this continent, at this moment, we need more partnership between the startup companies, also maybe including the acquisition. And it could be a bit sensitive topic, but in this context, I think investor can play some role to support the startup company because we have a different network, and also we have a different view of how each company can grow. And as Asia also, we focus on the healthcare sector. We see some collaboration synergy in between portfolio companies. So that's something we should do as an investor.
Okay. Thank you. It's a partnership or consolidation among startups, and investors can be very catalytic to make it happen. Okay, Jim?
Yeah, absolutely. I would say the way in which our investors have been able to open up doors for us. So some of the things that we've been able to do, having investors plug us into public health solutions. So we do a lot of work in the public health space, with partners such as HealthTech Hub Africa, with AIC, with AXA, BMGF, Global Fund, Novartis, and really opening up these doors for us to do more. So even beyond what our original business model was, seeing opportunities where we can grow. So I'd really say the way in which, that model of hand-holding and taking us, have you considered this? And I think for us, where to date we've digitized 1 million patient records, we've been able to serve about 1,000 facilities. I'm not entirely sure we'd be able to get there in the 6 years if we did not have the investor support. Just having them walk that journey with us, we've been able to grow a lot faster than had we tried to do it on our own. So just having that walking alongside us to enable us to scale a lot faster.
Okay, thank you so much. I think there's so many supporting mechanisms, including some of the speakers introduced previous to this specific session. Typically, like innovators or startups management team, you have to focus on like day-to-day, immediate things, cash management, increasing your user base, and contract negotiation and so forth. You are focusing on something immediately in front of you. Probably that's where the investor can help you a little bit, broaden your horizon, connecting you somebody else, potential partnership, potential expansion. So my takeaway is that one from this specific partnership, and mutually managing expectation, at the same time supposing something very tangible and practical, not just like pushing, okay, show me the result, but you are part of the team, so to speak, and you are providing tangible support. So that is my personal key takeaway. I'm sure the audience has your own takeaway depending on who you are. Sorry, I think we don't have time remaining to take any questions, Olivier, unfortunately. Yeah, but thank you so much, first of all, to the two distinguished colleagues here, and also this wonderful audience who came over here to make this room like fully packed. So with this, I'm handing over to Olivier for the wrap-up part. Thank you so much.
Thank you.
Thank you so much, Takeshi and the team. So with this, we're wrapping up our first session of the Investor Summit. We discussed the current context. We identified the barriers, the key actions we should be taking moving forward. I would like to highlight that this is not the end. It's the beginning of a long conversation this week, and probably as we move forward to ensure that we move forward these conversations. So we have the next sessions taking place in MH4 from 11 to 1 p.m. And this will be talking about patient centricity and AI in health. And with that, we'll have more panelists who will be sharing their insights. Tomorrow, we have the next session, which will be about pitches from startups and also our launch for the standards and interoperability lab, which will take place at the Noskin House, Kigali. So you're all invited to join us. Before I wrap up, I would like to thank all our partners who were with us, starting with the Ministry of ICT and Innovation, but also our event partners, PATH, GCC, and BCG. Yeah, of course, our key anchor partners, Novartis Foundation, McGovern, and the Global Fund for making this happen. We hope to continue the conversation. If there is more question, please feel free to reach out to the panelists, speakers who are with us, and discuss. Thank you so much.
with screening and early detection and active management. But of course, this is challenging to do, and often even more so in the African context, where we have relatively weaker health systems and where we have a growing need for this. So today we're going to be showcasing the opportunity of health tech to optimize the prevention, early detection, and long-term management of chronic conditions, including cardiovascular disease, mental health, disability, and HIV. And you're going to be hearing from some wonderful innovators from Rwanda, from Tanzania, from Kenya, and from South Africa. And we hope you're going to walk away really energized and inspired by what you learn from them. But to start off, we are going to hear from Dr. Ambaber, who is an esteemed medical epidemiologist from Rwanda's University of Global Health Equity. He has almost 20 years of experience in Ethiopia, in Malawi, in Rwanda, in the UK, and who better to come and talk to us about the burden of chronic conditions in Africa. How big of a problem is this? So please come and take the stage.
All right, thanks everyone. Just to start on the burden of chronic disease in Africa. Globally, non-communicable disease account for 71% of the global diseases, with a rising burden in low and middle income countries. Each year, 17 million people die from NCDs before the age of 13, and sadly, 86% of these premature diseases occur in low and middle income countries. So this is a global burden of disease data from sub-Saharan Africa, all ages and all sexes, and each box represents years lost with disability, which is a burden of non-fatal burden of disease. And in 2021, as you can see from the shaded boxes, mental health, musculoskeletal disease, particularly back pain, cardiovascular disease, actually account a substantial non-fatal burden of diseases, and there is an increase in the last 13 years from 1990 to 2021. So in terms of net fatal burden of disability, NCDs actually account a larger burden in sub-Saharan Africa. This one is a premature mortality measured by years of life lost, and clearly in terms of premature mortality, we still, in Africa, we still have maternal days, neonatal days, and infectious diseases. But what is striking is, in the most recent years, premature diseases from neoplasm like cancer, diabetic, chronic kidney disease, and cardiovascular disease increased substantially. This is, again, the burden of disease in Africa from 1919 to 2021 using the global burden of disease data, sub-Saharan Africa, both sexes and all ages. And then the y-axis is a percentage of total DALYs, disability-adjusted life years, which is a combination of premature mortality as well as disability. And accordingly, non-communicable disease account for 30% of the burden of disease in 2021, which is an 18% jump from 1990. So a huge burden as compared to other conditions. And this is just similar to the previous slide, but zooming in only the non-communicable condition. And as you can see in 2021, the proportion of disease burden attributed to chronic disease has increased substantially, with particular increase in cancer, neoplasm, and cardiovascular conditions. This is just showing you some of the proportion of diseases per 100,000, which is a crude mortality rate, and then non-communicable disease compared to HIV and STIs. And as you can see, the proportion of diseases in the early 20s, in the early 2000, were predominantly from HIV. But nowadays, like in more recent years, thanks to the antiretroviral therapy, deaths from HIV has reduced significantly, whereas cardiovascular diseases and deaths from neoplasms account for a larger proportion of diseases in sub-Saharan Africa. And then this graph just shows, a comparison of the burden of chronic diseases in sub-Saharan Africa compared to other regions. And then if you look at the bottom one, both sexes age standardized in 2021, sub-Saharan Africa has the highest age standardized disease burden, both in terms of disability as well as premature mortality. So this is very recent data that we did in Rwanda, looking at and understanding the needs and solutions to promote healthy aging as well as multimorbidity. A large study covering a population of over 4,000, over 144 villages in urban and rural Rwanda. And then we found that at age 40 and above, of course, we found that multimorbidity is quite high, actually 55.2, which is defined as 2 or more conditions, and higher increase with age, higher in urban area and higher in female. And fertility is also substantial. Disability score is high, and the mean quality of life quite low, and substantially affecting female and higher in rural area. So you can see now the problem with NCD. So what are the challenges in NCD's management in Africa? Clearly, we have health system barriers, like shortage of healthcare providers, limited infrastructure, patient-level barriers, including low awareness and health literacy, financial constraint, as well as geographic inaccessibility. This is a map that shows the densities of physicians and nurses and midwives per 100,000 population in Africa. And then, as you can see, the one in green, accounts only 4 countries, I think, Namibia, South Africa, Mauritius, and Seychelles, have 4 physicians, nurses, and midwives per 100,000 population. The rest less than 1 or 2, particularly the one highlighted in red. So clearly there is a disproportionate in the densities of physicians, nurses, and midwifery. This is relatively from a recent study. Clearly, we have a number of challenges, and digital health is, I think, one important solution. And interestingly, 82% of African countries have e-health strategies. There is high mobile phone penetration. And then this is further boosted following COVID-19 and lockdown measures. And there are diverse digital health interventions that has been piloted in African setting. One is mHealth, telemedicine, also artificial intelligence and machine learning. Just looking at some of the studies that looked at mHealth intervention for diabetes management in African setting, some of the interventions include SMS-based education and reminders, smartphone apps for self-management, telemedicine consultation. But the key lesson from some of these studies is that there are still limited evidence on effectiveness in African context, and we need rigorous large-scale studies. And from a cardiovascular disease management point of view, some of the mHealth interventions include patient self-monitoring and lifestyle modification that has been well studied in African setting, remote monitoring of patients and virtual care, mobile outpatient, telemetry, smartwatches, and handheld electronic ECG devices. What are the challenges and considerations? So we have challenges related to infrastructure limitation, particularly internet penetration and power, and we have issues around digital literacy and technology acceptance. We have issues around data privacy and security concerns, and of course, issues around equity and access, which we need to all work together. In conclusion, and a call for action, there are, I think, critical areas of research priorities in this area. One is we need a large-scale effectiveness studies. There is a cost effectiveness analysis so that we can inform policymakers for policy and practice. And we need implementation research. We need to look at the fidelity or acceptability of some of these interventions. We need to look at the penetration. We need to look at the adaptability. And we need to look at the equity using implementation research. And of course, we need investment, increased in investment, capacity building, and public-private partnership. And I think some of our panelists will also highlight some of these interventions. We will end here. Thank you.
Thank you so much. So I think we're hopefully now all convinced of the enormous burden of chronic conditions in Africa, only growing, and relatively underfunded and under-resourced compared to other conditions. So this is an area of latent demand, and luckily we have some innovators that are responding to this. So we're now, for the next 25 minutes, going to take you on 2 journeys. So sit back, relax, and come along with us. One of these is going to be a journey that you're probably all very familiar with. It's filled with delays, frustrations, missed opportunities. But the other one, hopefully a little surprising, something new that might show you some of the opportunities. So here's our traditional health journey. It might start something like this, with a billboard, or maybe it's a poster tacked up on the wall of a clinic that has some sort of generic message around how we can start to care about our health. But what if prevention could be personal and right at the tip of our fingers? So today I'd like to call up Peace, who is the co-founder of Livestream, who's going to tell us exactly how this is already happening in Rwanda. Over to you, Peace. Use this one.
Thank you. So as mentioned, today I'm here as a storyteller. So sit back and enjoy the story. So I'm here to tell you that everyone in the world can be categorized into just 4 groups. The first one being the fighters, and these are people who are already living with chronic diseases like heart diseases, hypertension, etc., and they're dealing with the symptoms every single day. So the second group is the risk takers. So these are people who are at a risk, unknowingly or knowingly, of developing one. No symptoms yet. And then we have the believers. So these are people who are not thinking about NCDs at all. They believe in luck or chance or God or spirits or anything you believe in, but NCDs seem distant and relevant today. And the fourth group, we have the lifestyle users, who are the people who may or may not have the risk factors today, but are taking active steps every day to maintain a healthy lifestyle. So do we have the believers in the room? Yes. So what do we do at Livestream? So at Livestream, we change the risk takers and the believers and turn them into Livestream users. And our mission is to provide solutions that help these individuals take control of their health before NCDs become a reality. So we provide them with knowledge, tools, and solutions that have personalized interventions specifically for prevention. So now imagine for a moment that you've been told that your blood pressure is slightly elevated. You feel fine, no symptoms yet, but the numbers are telling a different story. It's not too serious, but what if it didn't have to get any worse? What if you could change the direction of the journey with now just a few simple adjustments? Even better, what if your blood pressure is normal, or as the believers, you've never had a checkup in your entire life? And what if you could hand you the reins to your health, back to you, and you don't leave it to chance or whatever you believe in? So that's what we're here to talk about today. How to prevent non-communicable diseases before they have a chance to develop through lifestyle changes. And here is a thought. How is it that the most deadly diseases, as we saw in the numbers presented earlier, affecting millions of people worldwide, are one of the easiest to prevent with small lifestyle changes, but no one is focusing on that at the moment. So the journey we're talking about, picture yourself back on that journey. The only difference this time is that now you've heard of Livestream Health Solution in a certain conference in Kigali, where we prioritize giving control of their health and allowing you to steer this journey in the right direction. So this is where Livestream comes in. So at Livestream, we've developed a mobile-based solution, but keeping in mind that everyone's health journey is different. So one size fits all doesn't work, but especially for non-communicable diseases. So since almost everyone in this room owns a smartphone, I can see all taking pictures of the screen. The same device you're using to take the pictures can be your companion in this journey. And with Livestream, you're able to, as you can see on the screen, you're able to measure and track your blood pressure, keep tabs on your progress, and make necessary changes as you go, all without stepping into a clinic. I believe most of us like the sound of that. So with that companion, you're the driver of your health, and you're able to identify warning signs early and make adjustments along the way. But maybe you're thinking, why start now? I feel great, I'm young. Well, me too. It's easy to overlook prevention, especially when you feel strong, but this is the perfect time to start. Taking those small steps today is how you ensure a healthier tomorrow. And don't worry, it doesn't have to be the boring or tough, lonely journey that we know at the moment, especially for our users. We've designed Livestream to make this journey enjoyable and rewarding. We've made it fun by rewarding you for every bit of progress. If you go for a run 3 times a week, how does a massage on the weekend sound? It sounds fair to me. So we get it. Sticking to healthy habits is really, really hard, especially when you're doing it by yourself. That's why we've added gamification into our solution. Little wins and challenges and rewards keeps you going. Plus, our community activities mean you've got a whole tribe cheering you on. So it's not just you against the world, it's you and your community all working together to stay healthy. And then there is the game-changing part. We're the second in Africa to integrate AI blood pressure monitoring technology. So you get access to regular health checkups and pre-diagnosis right through your phone. So imagine being able to check your blood pressure without leaving your home and knowing exactly where your health stands before things escalate. So with this is the future of health, using AI to catch issues early, allowing you to stay ahead of the curve. When you have access to these tools, access to information, easy health tracking, and early detection, you're not just reacting to problems as they appear, you're actively preventing them. And so why wait? So through this work with Livestream, we've been able to reach over 2 million people in just 2 years, raising awareness on NCDs and early diagnosis. With more partnerships and support, we can expand our efforts and reach even more individuals at the risk of developing non-communicable diseases. And one last thought for the investors and the number of people in the room. For every dollar invested in prevention of NCDs, there is a return of $7. So you can do the math. And that's how powerful prevention really is. So the believers and the risk takers in the room, let's start with prevention today, and we can talk after this. Thank you.
Thank you, Peace. Sadly, we're back on that old health journey, the traditional health journey. Maybe this time we've had to go to a health clinic. There's a waiting area that's crowded, full of people. They've all got different problems. There's an overworked nurse or doctor. Maybe our client decides it's not really worth it. I'll go home, come back later when these early symptoms have finally become so severe they can't be ignored. But what if instead we invested in user-friendly health tech solutions so that a client from the comfort of their own home could access the care that they need at the very first sign of concern? I'm going to call up Nkata, who is the founder and CEO of Transmed, to tell us how this early detection is happening right now in Tanzania. Over to you.
Thank you. Thank you. Before I start, I'd like to ask in the room, when was the last time to go for the checkup? For the medical checkup? Is there anyone can volunteer? Anyone in the room? Yeah, we have one. And when was the last time to go for the checkup for the mental health? Oh, you do even know if there's mental health checkup? People are laughing. Means like a lot of people, we don't know like if you can go to the health facility for the health checkup. So that is what's happening to a lot of us in community. Today we are talking about prevention. As we all know, talking about the mental health, if you talk mental health, everybody, we are thinking about madness, mental illness, or something like that. And you are not alone. This is all over in our continent. For example, in Tanzania, the data shows 1 among 4 people in one time in their life, they experience mental health challenges. And coming to the like professionals in Tanzania, we have 0.07 psychiatrists and 0.01 psychologists to the 100,000 communities or peoples. So the number of professionals are very little. And not only talking about that, when speaking about the mental health, as I mentioned, there is a lot of stigma around it. People don't want to talk about it, and people are mixing it with a lot of other. And we can see now in our continent, there are a lot of these pastors, these like ministries who are involving in that sector. So people are going to the hospital at very late stages. For example, in Tanzania, last month, we did capacity building or outreach. We went to one school. We were very well welcomed at that school by the headmistress. But for me, when he saw us, he said, like, wow, you came at the very right time. But we were introducing, we came with our partner who is coming from Mirembe. Mirembe is a national mental health hospital in Tanzania. And that is the oldest hospital. It was built since 1920, that hospital. So when we measure that, that makes us say, wow, why did you come with this person? Why do you come with these doctors? Why? Because people, they even think, talking about the mental health, you are welcoming the mental health. That even why in our country, our former minister, she presented the wish to change the name from the Mirembe to something else to reduce that stigma. So for us in TransMed, we said, let's get inside. TransMed, we are medical healthcare super app. We are building like a marketplace for everything in your app. It's a lifestyle super app. It's not for the patient, it's for everyone. You, me, and everyone can use TransMed. So when we were doing this app, we wanted to have the AI-based mental health assessment tools. But the challenge came, there was not enough data to do that. And when we go to the minister, we go to the people, they said, no, you can't do, because all the tools available, they're using data not from Africa, not from Tanzania. So how did we navigate that? We said, we cannot leave this innovation. So what we did, we sat with the people or professionals from this mental health hospital. We incorporated the existing tool, which is already approved by the Ministry of Health in Tanzania. This tool is very boring, very long. It had like more than 60 questions. You cannot ask somebody all these 60 questions. So what we did, we use the AI, machine learning, to understand the user. And we take through user, and we take all those questions, we present it in a way like every user, they will like it and they will use it. So with that, so in doing that, we engage a lot of professionals. Like you can see the picture down there when I meet with the Mirembe National Mental Health Hospital. So we did that, and during the process of doing that, we engage youth, because in our application, or in Tanzania, 75% of users are youth, of population are youth. So we engage youth to design their own TransMed. And that's what you see in the left, the first picture. Those are the youth where they were designing their own app. So we are not digitizing. We are making the user-centric or youth-centric application which could be used by the youth. So since we started this our application, for now we are reaching more than, in Tanzania and across East Africa, we are reaching more than 4.38 million users. And among them, you'll be very surprised. We are, for example, now we are getting almost 2,000 users or subscribers from Kenya and also from Congo and from Tanzania. If we are amazed, like Tanzania is the third user base in our application while we're in Tanzania. So this is the power of digital technology. But when we started doing this, we faced another challenge. These people, they are living in the community, and we cannot reach everybody there. So we, in collaboration with the Ministry of Health and others partner, including USAID, they funded us so that to do two things. Number one, to reach the CHW, community health workers. These youth are in the community. So your intervention is useless. We say it doesn't matter. Your innovation is useless if it cannot be used by the people. So these CHW are empowered by the professional, very few professional, and they can help this youth directly from the village or from their part. So with our app, users can do a lot for the prevention. Not only assessment of their mental health condition, they can do assessment. After assessment, they can be linked with the professionals. After, not only that, we have the mood tracker. They can track their mood. They can create goals. And they can associate, they can work with CHW to accomplish their mood. We've trained more than 400 CHW. And for now, I can say in Tanzania, this is a widely used application in mental health. So this is the way how we are tackling the mental health across Africa. I'd say across Africa because our application or our solution is working not only in Tanzania, but all over Africa. And now we are available in English and Swahili, and very soon we're adding Lingala and French. And very soon also, we're adding other local languages to make it a localized solution for preventive in mental health. Thank you.
Thank you so much, Mkata. All right, we're back to that old journey. Each time you see what the possibilities are, but sadly, we're back here. So at last, our client has got a diagnosis, but the condition is chronic. We're back in this health clinic. It's full of sick kids, impatient health workers. They have too much to do. They have none of the supplies that they need. But what if our client could be connected with this network of providers that are offering online and home-based therapies so that those frustrating clinic appointments could be a thing of the past? So let's call on Ruth, who is the Chief Technology Officer of Izola, who's going to tell us how this active management is happening right now for children with disabilities in Kenya. Let's give a round of applause.
So I'm going to share with you a personal story of mine. When I was 5 years old, I watched my family struggle to care for my older sibling who was diagnosed with autism and cerebral palsy. Our lives were filled with stress because my mom had to quit her job so that she can become a full-time stay-at-home mom so that she can take care of him. And for us, that meant that the quality of life that we once knew had to change. For example, we had to switch from schools, switch from neighborhoods, all that. Even so, she still had a hard time finding the right care for him, whether it was getting the right therapists to work with him or even getting the right reliable information so that she can support him. Unfortunately, our family story is not unique. Globally, 1 in 160 children is affected by autism. And sadly, less than 20% of these children in Africa are able to access the care that they need. Getting help is very expensive. A therapy session can cost between $20 and $60, and it is rarely covered by insurance, meaning many families are unable to afford this, especially long-term care. Additionally, getting the right therapist who can work with the unique needs of your child is hard. And on top of that, getting reliable resources online is hectic. So these families are often left feeling isolated, alone, and also without any guide on how they can support their loved ones. How can we make their lives easier? This is where Isola steps in. Our goal is to simplify the neurohealth journeys of families affected by autism and other related conditions by providing them access to the resources that they require. We've come up with a comprehensive solution, digital solutions to support these families, starting with our Isola therapy platform. Let me just share that. So through our Isola therapy platform, these families are able to access qualified therapists who offer them personalized therapy services. And they can access these services virtually or in person, whether at home or school, because we understand that each child's needs are unique. So we need to tailor-made their therapy solutions for each of them. To complement this, we developed the Zaidi AI Life Coach. It's a mobile app that provides them with personalized expert advice and real-time support from these licensed therapists, enabling them to get daily tips to manage day-to-day challenges that they face. Additionally, through our therapy centers that we are soon launching, they'll be able to come to our centers, especially for those who don't have the smartphones that some of us have. They can go there, access these services from our centers. Good thing with the advances in AI, we are now able to deliver digital therapies much more efficiently and even at a lower cost than traditional methods. And that means that care is now accessible and affordable for all families. My mission with Isola is personal. And I understand what it feels like to be part of a family that is in search of help and support for your loved one. And I feel like no family should go through this alone. Right now, so many children with autism and other conditions are not getting the care they need, but we can change this. And that's why I'm inviting all of you to join us, Isola, in transforming the lives of these families and simplifying their neurohealth journeys. Thank you.
Thank you so much, Ruth. So this is the final step in our traditional health journey. Perhaps it all just starts to feel like a bit too much. Our client skips an appointment, they don't pick up their next supply of medication, they drop out of care. But what if a health worker, armed with a point-of-care risk segmentation tool, could anticipate our client's risk of dropping out and take extra special measures to reach her before she's lost to follow-up? I'd like to introduce Lucien, the co-founder and CEO of Palindrome Data, to tell us how this risk segmentation is happening right now in South Africa and Nigeria.
Thank you, Joanne, and thank you all for your attention today. Palindrome Data is a health tech implementer. We specialize in predictive analytics and advanced data services. Right now, my predictive algorithm is saying there's 23% I fall off the stage, so I'm very careful not to kind of knock through here. But in all seriousness, I want to just thank you for your time today. I want to talk a little bit about the patient journey in care. What we typically find is that in our facilities, it might surprise you that we are over-servicing the majority of our patients. What might also be surprising is that only about 20 to 30% of patients are being underserviced. Of course, the reality is healthcare providers don't know which group their patients fall into and how to anticipate how they transition from one risk segment to another. So this is what a typical patient journey might look like. They come in, they have a moderate amount of risk associated with them. Some of them tend to do fairly well at the beginning. They come and meet their appointment times, and then they might have a little bit of a wobble in their life. You know, they could lose their job, there have been some relational or substance abuse issues, and what we typically see in the data is that their pattern starts to show an elevated amount of risk. And what we can do now with these systematical AI technologies is track their patient and ensure that we are delivering the right interventions at the right time, which is pretty critical. Our research has shown that when a patient goes from green to yellow or yellow to red, their likelihood of disengaging doubles. So going from green to yellow is a prompt for a healthcare provider to show additional attention and to perhaps provide more intensive interventions. Quite similarly, if they're going from red to yellow and green, they can then start using interventions that may decongest the facilities, whether that might be pickup boxes or even have them to do multi-month dispensing. So this is the first key part of what we do, which is deeply understanding the patient, not just by age and gender, which I think the sector has been guilty of. Very often we look at young men as risky and older women, for example, as less risky. And while that might be true on the average, our research has shown we can identify pockets or groups of young men that are lower risk than elderly females by, again, not just stopping at demographics, but really layering in the behavioral, psychosocial information into our profiling. I want to bring this home by just giving two examples about why this matters. So in the first example, this is from South Africa, and if any of you have spent any amount of time in a healthcare facility in rural South Africa, you will know that the back office can be quite chaotic or disorganized. They're often managing lots of patient folders, and there's very little prioritization being done. We deployed this tool in a very remote part of South Africa to simply score the riskiness of patients disengaging from care. And what you see at the beginning of the study when we deployed the tool, the file pickers were actually prioritizing the low-risk patients over the high-risk patients. And over time, firstly, we were able to gain line of sight into how they were spending their time, whether they were actually differentiating their care, and then being able to provide guidance and nudges so that towards the end of the graph you're seeing, they were in fact prioritizing the higher risk red folders, and then having their case managers reach out earlier, more frequently, in anticipation of them again missing that next appointment date. The key difference here is that while the sector has typically done things very retroactively, what Palindrome is doing is anticipating the loss to follow-up or disengagement or interruption in care, as we call it. Something that's very critical, a speaker yesterday mentioned, is that it's expensive to get patients into facilities, but it's actually more expensive once they've disengaged to bring them back. Tracing and tracking is ineffective and it's very hard. What this allows you to do is, while the patient is still sitting in front of you, to be able to do something different for them. And then lastly, in our work in Nigeria, we are really starting to see the impact of our work. What we have going there is a control and intervention arm where we have a case management app deployed with our partners, Japigo, and what they are actually able to now see is that for the control group, where we do not include risk scoring and guidance on interventions, there was a reduction in IIT or interruption in treatment of 4%. while where a case manager engages with a risk score. So they're actually able to see whether this patient is being flagged or anticipated for a disengagement in care. The likelihood of the actual interruption in treatment goes down by 6%, which is 1.5 times more. And again, think about the efficiencies that can be brought to your programs by just moving the needle on how these interruptions in treatments can be reduced. So I'd love to chat to you more. We've got lots more evidence on how these risk scoring and predictive analytics can be used in facility. We've been doing this for about 6 years, so while it does seem like AI and LLMs are taking over the world right now, that's actually the easy part. It's really about building the tools and workflows that are fit for purpose for our under-resourced clinics, and we've been doing that for about 6 years now. Thank you so much.
Didn't fall off the stage there, so glad. So just a big round of applause again, please, for all of our speakers. Please put up your hand if you heard about a solution that you hadn't heard of before. Good, wonderful. Well, I hope you'll speak to them afterwards, or if you come to the HealthTech Hub Africa booth, we can make sure that you have contact information to get in touch with them if you'd like to, or just a little plug that if you need something to do tomorrow afternoon, come across to Norsken House when this Africa Health Summit is finished. Come across to Norsken House where we will have several innovators pitching and some networking so that you can meet some of these innovators, because I know which journey I'd rather be on. So thank you all so much. We're now going to just have a couple of questions with the panel, and please think about your own questions. There is a mic that will rove. There's one here. And if you have some questions from the audience, we can take those from the panel. All right, so thank you so much, colleagues, for all of your, for everything that you shared with us. So I'd just like to start with the same question for all of you. Let's start with you, Lucien, and then we'll move back this way, which is, number one, what is the biggest opportunity that you see and would like to seize? And then following that, what is the biggest barrier or obstacle that's stopping you from seizing that opportunity?
Sure. The one thing that I love about these techniques and technologies, I'm actually from the private sector. I did this in financial services, credit scoring for a long time, and then was able to transfer that into a healthcare settings and specifically HIV disengagement. So for me, the biggest opportunity is just the various use cases that this technology can now be applied to. Google and Uber have built these very sophisticated machine learning models that we leverage, and we can actually use them on our local context and get quite a lot of value out of that. I'd say the biggest barrier is a misunderstanding of the regulatory environment and data privacy and access. While we have to always be extremely vigilant in terms of data governance, I think educating departments of health and ministries is quite a crucial part of our job to get them to feel comfortable when deploying these technologies. If anybody remembers Cambridge Analytica a few years ago, we sat in Washington talking to some very senior people, and they were like, we will not use AI and these kind of techniques on our populations. And I think that COVID changed that quite a lot, but I think there's still quite a lot of education and acceptance that needs to come with these technologies.
Thank you, Lucien. So Mkata, how about you? What's the biggest opportunity you're trying to seize? What's the biggest barrier you're facing?
Yeah, from my side, what opportunity I can see, the technology has made scalability to be very easy. For example, for now, when we started, we just started for Tanzania, and we wanted to focus that market. But the technology allowed us to penetrate to many other countries even for us going there. So, and as you can see, we in Africa, most of us, we share a lot of things in common. So the opportunity I see is they use the technology, saving the people, and you can scale in all over the continent instead of just thinking in your country. Yeah, the barrier is, it comes like as opportunity. As you know, we are working in a very highly moderated sector, the health. So this make a lot of restriction on the way. So, so for us, what we think is understanding regulation, having a good collaboration, and also working with other partners. As you can see yesterday, we were in the policy summit. So all of that will pave a way for our innovation to go through and mature across Africa.
Great.
For me, I can say the biggest opportunity is telehealth and AI chatbots. We are used to, when we are sick or we need medical assistance, we have to go to the hospital. So that means long queues, waiting to see the doctor, or even, it's such, with telehealth and health platforms and AI chatbots, we are able to mitigate such challenges of long queues, and through such platforms, you can be able to see your doctor anytime at the comfort of your home. You can be able to use an AI chatbot to also help you answer some medical questions you might have. So there's no point of spending time in traffic as you try to reach your doctor. So I believe that's one of the biggest opportunities. A barrier could be or is digital literacy. So not a lot of people have embraced such solutions. Also in some of the medical practitioners, right? The doctors, the therapists, they lean more towards using what they are comfortable with. And that's more like what I call the traditional methods. Another barrier I'd say is data privacy and regulations. It's also expensive to create such solutions, right? And with regulations, they require you, for example, to host data in the country that you're practicing in or you're seeing patients in. And that's a challenge because we've not really expanded much into cloud services, especially in Africa. These huge, can I say, cloud providers like Google and AWS, the nearest can I say data center is in South Africa. Here we're in Kenya, we're in Rwanda. We don't have a data center. So we need to reach out to data commissioners to get that permission. Yes, so those are some of the challenges that we normally face, and it makes embracing such solutions take much longer.
Thank you, Ruth. So already we're hearing a lot of these ecosystem challenges, policy, regulatory challenges, data hosting, and of course change management amongst health workers and data literacy. So if you in the room are working on any of those topics, please hear your call to action here, because this is the kind of support these guys need. Go ahead, please.
I see the biggest opportunity, especially with the pre-diagnostic tools, through integration with the already existing solutions, especially with the government. Because there is no way we're going to be able to deploy this, especially in the community, and specifically for an AI-based healthcare solution without the support of the government. And the challenges that comes with this, the first one is that they're also looking for successful use cases to use, so as they're able to invest in you and back you up. And if you're talking to investors or looking for partners, they're still also looking if you're working with the government. So there is already a mismatch there where everyone is looking for those use cases, but no one is coming on board to make that happen first. And that the other challenge that comes with that is that there is a double burden where our systems are already struggling with existing cases. So prevention seems like it's not an emergency at the moment. In Rwanda, we have 55% of hospital admissions are caused by lifestyle diseases. So with the already limited human resource and other forms of resources, they're already struggling to battle with that. So coming in with prevention doesn't really seem like a priority. But with 2 out of 3 people at a risk, if nothing is done on the prevention side, and this is specifically why they need the private sector to partner on this, if nothing is done, those are the same numbers that are going to turn into now people living with those diseases if nothing is done.
Thank you, Peace. And there, Alamahu, we hear your call to action because obviously from your vantage point as Chair of Population Health, you really have this role in making the case that this prevention is a critical place for investment.
Thanks, Johan. I think for me, in terms of opportunities, I see there is a lot of appetite from policymakers to take some of these health intervention into impact and applying into healthcare settings. So I see that, I think, a great and excellent opportunities we need to tap in, particularly after the period of COVID. And then second opportunity I would see is the internet penetration has increased, and I worked in Malawi and in Rwanda, in both countries. Internet penetration has increased through time, so there is, I think, enormous opportunity to tap in some of this digital health intervention for prevention or treatment or follow-up of this chronic condition. In terms of challenge, I come from the university, from academic university. I see a lack of critical mass of scientists who can take some of these research questions, take forward into either clinical research setting or into population health research setting. So we really need to invest in capacity building, building in next generation of data scientists who use big data for analytics, for AI, for machine learning, etc. I think that we really need to spend on that end, and pleased to see Peace is one of my students, and seeing her here is really a pleasure. And the second challenge is funding, particularly from a research point of view. I think there's a lot of competition, particularly if you wanted to do some cost effectiveness studies, some effectiveness trial, focusing on implementation type of studies. I think there is a limited resource and competition in funding. So we really need investment in research and funding. That's one challenge as well. Thank you.
Thank you. All right, I think we have time for probably about 1, maybe 2 questions from the audience, if there are any. So if you have anything, all right, I see a hand at the back. Okay, good, there are a few. There's a mic coming to you now, if you wouldn't mind just asking your question.
My name is Nimzing Ladep. I'm an independent developer, and I have HealthTech. My big question is about the tendency, our culture back in Africa. In some communities, there's denial. In other words, you go to the hospital if only you want the doctor to validate the fact that you are not having the condition for which you're going. That I may be wrong, but somebody can correct me. And so now taking that down to tech, handheld devices, the big challenge comes. How have you navigated educating patients, for example, to interact with a chatbot? Kind of, for example, they are afraid what may come back as what they input, what would they get back? It may be something they don't want to know, or something like that. What are your experiences on how to get patients to engage with a device rather than a human? Thank you.
You'd like to take that, Mkato or Peace, or even Ruth? Mkato, go ahead.
Yeah, thank you. To do that, you have to make a user-centered application or solutions. Make them involve. For example, for our case, we involved youth, and they gave us what they want, and even what they are thinking to have, and you localize it. So even the outcome which is coming, most of the time we don't mention you are sick from this disease, because even the law doesn't allow that. but we tell them in a way it can link them to the next point. So it's just like human-centered design can work for that.
So if I may add something, so from our experience at Livestream, we've seen that the market, or the African market specifically, is not at the level where a digital platform is enough. They still need that human-to-human conversations, and whatever you design, it needs to be accompanied by that contact. So we have what we call, for some of our solutions, we work with community health workers. If not, we train what we call the ambassadors. And their role, we take specific people in different communities, so different schools, different churches, different markets, etc. And that person is trained on the basics, the risk factors, the pre-diagnosis, and in a way they have the tool, the digital tool, but they also have someone they can go to, and that acts as a link between the digital tool and now visiting a hospital if you have to.
One more?
Can I add to that, John?
Oh, yes, of course, Ruth.
Yes, so I understand your question is on general inquiries in medical side, right? And it's usually so simple, like when you go to any online site, let's say on Google or whichever place, and you just type, I have a headache. That's one of my symptoms. And the results, in the end, they end up telling you something like, makes you feel you're going to die anytime soon. And it's so challenging, right? You don't want to see such results. In our case, Isola, in our chatbot, Zaidi, we've trained our data based on different use cases. For us specifically, our use case is for neurological conditions. So we ensure to train the brain of our chatbot with enough information to assist any person who comes in with such symptoms. And of course, there should be a disclaimer. An AI chatbot is not really a doctor. That's why it's important that in such platforms that have AI chatbots in them, you have access to a health practitioner, right? And that can be a therapist or a doctor. And just like patients here had said, their platform does that, as well as our Saidi platform. So you have the option of talking to a real doctor, and they can speak more with you and even decide, let's take the next step forward. Yeah.
Thank you. So we've got just 2 minutes left, so I think we can take one more. I'm seeing a hand here. Where's the mic? You want to give it just there? Thank you.
Thank you. Yes, and great presentation, everyone. Listen, I really appreciate the mention that you did about the HIV patient tracking, and I just wanted to ask how long can it take to implement your solution, maybe in the country? Thank you.
Yeah, thank you. That's a great question. I can make this very quick. Maybe we can get one more question after this. It takes us about 90 days from the time we get a data set to build a model. Now, that's the easy part. The machine learning, the AI, as overwhelming as it can seem, is the easy bit. It's taking that solution, embedding it in an existing workflow, an existing tool. That is the real hard work, and that could take, several months to years to get it just right. So again, the data science, 3 months, we can get you something up and running.
I see one hand there, one more. And then don't worry, I know there's lots of additional questions. You can catch them afterwards, or certainly tomorrow afternoon.
Yeah. Thank you very much. My name is Lilian, and I'm working for EDPU Africa, where we do actually early detection and prevention of non-communicative disease, which is actually the silent killer that is growing on a day-to-day basis, and we are based in Rwanda. I will first start by thanking you all for the good presentation. That's really interesting. And I had a question that I guess any of you could pick, or a challenge that we are facing is actually, okay, with our system, basically we are able within 20 minutes to do a screening, quick screening, who is validated by a doctor and provide advices on, your current or picture of how you stand currently and try to track now how you evolve. But we are facing a challenge to reach the less financially privileged, because of course at time you don't have, they are in remote areas. At time you don't have even electricity. Our screening is mobile, so we're able to get units and to get to them. But financially, it's really difficult. So I wanted to understand, how do you, what are your financial models? Are they different? Is there anything different than grants? Or how do you manage that part to be able to reach the broader part of the community? For those in town having insurances, we can work with insurances so that the cost is not that much. But for those that, the majority of the people that really needs it, that are not able usually to get even any screening, that needs to be educated, it's a challenge to get to them. So I wanted to get a bit of your experience and how basically you are handling that part if you are facing the same challenge. Thank you very much.
Thank you, and I'm glad to see that we have EDPU in the room. So when we're designing this solution, the persona we're working with was specifically someone who doesn't necessarily have access to the existing solutions. And that's the biggest number, especially in African countries. And the challenge is, if you're not going with digital, if you have physical solutions, then you're still leaving these people out. Because people in cities are able to buy the cuffs and do this diagnosis on their own in the comfort of their own homes. So that's why we came in with the model, especially with the ambassadors I was talking about. In a family with the penetration rate, I'll speak for Rwanda, we have for smartphones, it's about 70% at the moment, and electricity too. So in one family, you might find one person who has access to a smartphone and who is comfortable with technology. So what we've done with that is that we have an option for someone to screen for others. So in that way, you don't need a whole family of 5 to have access to that. It can even be your neighbor. And this is where partnerships comes in. So with our recent pilot with RBC and the Ministry of Health, we're able to work with people who are already in these communities, who are already trained on NCDs, whether it's community health workers or anyone else. They already have access to smartphones. They already have access to the basics. So all you need to do is avail a platform like Livestream. And with the option to screen for others, we're able to get from your account that I'm screening for Peace. She's 35 years old, and she's already living with diabetes. And all this information goes to one dashboard, but you're able to tell this came from this one and this came from this other person. And with the grants and the support to do this, there are a lot of organizations, and I believe you should talk to the HealthTech Hub, that are looking at different solutions targeting people at the lower category of the pyramid, people struggling to access the current services. So you can talk to some of the organizations, but also look at the different solutions that already exist that makes it possible for those people to have access to diagnostics.
Thank you. We're going to have to wrap it there, I'm afraid. But let's give one last big round of applause to all of our speakers, and thank you for your interest.
direct to the next panel session, which is looking at ecosystem issues around AI. We've been hearing about AI from the morning, from the keynote by the Minister for ICT, and even on this panel, we had quite a few AI solutions. So in the next session, we'll be looking at how do we build an ecosystem that is able to not only support AI solutions, but enable them to thrive. So I'm going to invite, I don't know whether someone can help me with the screen to project the photos of the next panel, as I call them. Great, thank you. So starting with Sanya, I'll do a brief introduction so that they can also get to introduce themselves. So first on stage is Sanya Chalwa, working with Cure AI. They use the power of AI for TB and lung cancer diagnosis. Let's appreciate her as she takes her seat. Next, we have Pulkit Agra from GCC. We had Pulkit in the morning session. Welcome, Pulkit. We have another amazing innovator from Tanzania, Harrison from Afya Intelligence. Let's applaud him as he comes up front. Last but not the least, we have Dr. Rose Nakasi, a lecturer at Makerere University, also the head of Makerere AI Lab. Welcome on board. All right, thank you. So as you take your seat, so I'm going to give all of you a chance to introduce yourself. Tell us about your organization and what you do at your organization, how you're using AI to increase access to healthcare as part of your introduction. Maybe we'll start from the one closest to me as we go to the left.
Thank you so much, Wilfred. I represent Cure.ai. I am Director of Global Health Innovation at Cure.ai. We are an AI-based radiology imaging solution startup. We help in interpretation of chest X-ray images, chest CT images, head CT, to help identify signs of different diseases such as tuberculosis, lung cancer, and so on. We are present in around 30 countries in Africa and have been working with ministries of health and different population health programs. Thank you.
Thank you, Sanya. Pulkit?
Hi, good afternoon, everyone. My name is Pulkit. I'm a portfolio manager with Grand Challenges Canada. I oversee all of our digital health investments across low and middle income countries. We are based in Toronto, but Grand Challenges Canada has invested in over 1,500 innovations in the last 15 years. 60% of them are locally led, and 300 of the 1,500 are actually transitioning to scale. Some of you might have heard me on the panel before, so looking forward to our discussion on AI today.
Thanks, Pulkit. I think the most important thing to note there is you're managing a $20 million portfolio. So innovators in the room, take note of that. Harrison?
My name is Harrison Mariki. I am a pharmacist by training. Happy to be surrounded by all of you solving these important challenges. So I lead a company called Afya Intelligence, and what we focus on is improving access and delivery of healthcare products. So we help healthcare workers and healthcare facilities to be able to understand and predict the demand for healthcare products. I am sure none of you want to be at a position where you are at a facility, you are seeing clients, and then you have to tell them that the medicine that they need is out of stock. I was able to experience that during my internship. That is like 12 or 13 years ago, where like the most thing that I used to write on prescription was out of stock. I never even finished the 12 months of internship. I requested to transfer to go to finish the 3 months in Tanzania Food and Drug Authority, where I was not facing the patients. So my journey since has been as a supply chain advisor, and currently we are leveraging digital health and the emerging technologies to now assist healthcare workers with solutions that can help them to be able to make sure that the commodities that they need is available. Thank you.
Thanks, Harrison. And we'll be coming back to you shortly to learn more about these challenges from a practitioner perspective, turning now into an AI practitioner. Next, we have Dr. Nakasi.
Thank you very much. Rose Nakasi from Makerere University, a computer scientist by profession. I also happen to lead the Makerere Artificial Intelligence Health Lab, where we're leveraging the capabilities of artificial intelligence to support and utilize it in most of these challenges that are happening in the healthy facilities. I also happen to be the topic group driver for artificial intelligence for malaria diagnostics under the global initiative for WHO and WIPO, where we're building standardized solutions for the use of artificial intelligence in health. If I can go specifically to some of the projects that we're working at, specifically on the ocular, where we're looking at using artificial intelligence to support microscopy diagnosis of diseases such as malaria, tuberculosis, and now in pathology, specifically we're looking at cervical cancer. We also build telehealth platforms, especially to support in the pathology department, to have communication and a linkage between patients, pathologists, to be able to give support to the patients. We're also building a chatbot that actually is able to communicate to patients in the languages that they best know how, and those are the local languages, so as to make it easy to communicate to the patients, who in actual sense is the major stakeholder in health. Thank you.
Thank you, Dr. Rose. I think we're very privileged to have a true triple helix on this panel. We have academia, we have innovators, we have investors, and I think this is going to be a really nice interactive session. To start us off, I'll begin from an innovator perspective, right? Those who are there and doing it. And I want to hear from Harrison, if you can share a little bit about, I'm assuming it wasn't easy to come up with artificial intelligence, and would like to hear more about the challenges we encountered along the way, be it regulatory, data access, funding, name it all, just from an innovator perspective.
Well, coming up with artificial intelligence, of course, it was not easy, but strangely, I think I make some decisions quite fast, especially when I see that it has impact on what I want to do. So I came across very young innovators in some sort of this, like it was like innovation challenge, where I was there also as part of a consultancy that I was doing, which was looking into how you could leverage, how would you adapt AI for healthcare supply chains. And then I come across these young guys who actually had very interesting solutions, but not pointing to like critical issues. And when we are just having these issues and I was explaining to them what I was doing, they was like, you know what you're doing is very interesting, like, because I was doing supply chain advisory. And for them, it was like, why don't we automate what you're doing? Like, why can't we make what you're doing accessible to everyone? And it made sense. And at that time, it was like, we were just thinking about chatbots, actually, which would help healthcare facilities in terms of like some of the inventory decisions that they wanted to make. We actually won an innovation challenge with that idea, and we got a seed funding the initial, I would say, fund for business formalization, which was through UNFPA, MUA Acceleration Fund. It was just 5,000, but it was critical, but really helped. So that's the story. In terms of challenges, there are quite a few. One, like I said, the people who know, actually, this technology, like AI, it's new. So if someone tells you like they have 10 years of experience, usually it's not very much relevant. Sometimes the skills are actually with people who are still in school. Like the guys that I just talked about, which I met, they were actually third-year students. So there's that mismatch. And then the other issues like for innovators of that group, for instance, is now accessing and knowing what the challenges are. So we want innovators to address the critical challenges, but at that level, usually they don't have those engagements, they don't have those relationships, they don't even know where to start. So for us, it was a good match because of the background that I had, and I've worked with the public health side for many years. So it just was a good match and a good place to start, but not everyone gets that opportunity. The other issues are around infrastructure, funding. In the public health sector, you meet investors who want you to be able to present a lucrative business model, which sometimes isn't as clear. And in area that we are practicing, like predictive data analytics, so we have access to data that we can actually help government even make better decisions, including commercial decisions. But sometimes even starting that conversation of like leveraging this data to make a business out of it can hurt your chances as a private sector and working with the government. Because saying, okay, so is this guy working with us to solve the problem? We're actually using this data to so there's that issue of trust that we have to work on. Thank you.
Thank you so much. And even in the previous panel, we heard from Lucien that building is the easiest part. It takes about 90 days or so. But getting the buy-in, the trust, and finally integrating in the health system, that's where the real work is. But let's hear also from QAI, who have had a chance to work both in Asia and Africa. Maybe it's different in Asia, right? Are you having the same challenges or different?
I think one of the challenges has been, as you rightly mentioned, how do you contextualize your solutions? What will work in a remote community setting is very different from what will work in a secondary or a tertiary hospital. What are the dependencies for your solution to work? Does this digital infrastructure exist, not exist? How do you kind of learn? How do you make your product so resilient that it works in different kind of settings? Particularly when you are a startup whose objective is to cater to public health. So you have to make your product, your solution as resilient that it can work without internet, without electricity, very less training time, so as to ensure maximum adoption. Some of the challenges we have faced are, for example, once we have demonstrated evidence in a pilot, how do we scale that up across the country? So that transition from pilot to scale within a country has had a lot of interesting learnings. And second is, how do you ensure sustainability of impact? You have demonstrated impact. How do you ensure, like you mentioned, that this is now absorbed and integrated within the healthcare system? How does the government or the healthcare system kind of absorb it? And there is continuity in the implementation. It does not get lost or with a small project. So those are some of our challenges. I think we have been very grateful to have found some champions, government stakeholders, funders and not-for-profit programs in both Asia and Africa. And interestingly, there has been a lot of learnings from different regions where we have been able to apply from Asia and Africa as well. Yeah.
And maybe as a segue to Dr. Rose, hearing all these challenges, what is the role of academia and research in generating that body of evidence? You heard from Harrison that there's the issue of trust, yeah? So how do we rely on data? Because we know evidence doesn't lie. So wearing your hat as a professor, an academician at Makerere, what is the role of academia generating the evidence and making sure now that we are using evidence-based or making evidence-based decision when it comes to absorbing AI?
Thank you very much. You bring such a very interesting topic on innovation and the linkage between innovation and academia. If we look at innovation, innovation is something that is widely recognized as an enabler to economics of any given country or institution. But for us to be able to realize innovation, there has to be a training, a skill set that should be available to drive innovations into existence. And that's where academia and research institutions come into play. Most of our institutions are those that rely on just the theoretical part, but having an integration where academia embraces the capabilities of not just the theoretical foundational science into innovation, but also coupling it with the real practical work, I think is the key to realizing impact of whatever science we're looking at. And that is why, and that was the major driver actually for some of the initiatives that we undertake at the Makerere Artificial Intelligence Health Lab, is that can we be able to nurture a community of students that don't just go out with the computer science or with the medical science they gather from schools, but look at the practical aspects of the projects that we run so that they are able to appreciate what they learn in school and what impact that comes with in the practical aspects. We try to build that up from the curricula because every aspect of it has a practical basis on it, and we usually integrate students into the existing research problems that are at the different labs within the university. And then we also incorporate that with the health, we collaborate with health hospitals, not only hospitals, but also the medical teaching hospital that is attached to Makerere University. There we're able to appreciate from the ideation of the problem to how can we be able to utilize emerging technologies such as artificial intelligence, to learning very well the different problems that are in the healthy facilities. For example, if you look at the problem that we're looking at for supporting microscopy diagnosis, it stems from the very fact that, well, that is the gold standard for diagnosing. But it comes with challenges, especially in our context, where we have very few skilled personnel in the medical facilities. So the idea that came to us rooted from the problems that we are facing in our medical facilities, to then how can we be able to leverage on academia to support and reduce such challenges. So to be able to understand the problems in context, to be able to catalyze on the capabilities of the technologies that we teach in the universities, both theoretical and then integrating it into a practical aspect, I think that has been the driving force to this work that we're doing, because we believe that is the source of impact. Even when we go to creating companies, when a student comes out with a practical skill, be sure that we are relying on a fully packaged human resource that is going to go out there, knowing the theoretical, but as well as knowing the practical aspects of the problems that are out there.
Thank you. And just curious, Makerere has been known as a world leader when it comes to public health. So if I'm not a student, let's say an innovator like Afya Intelligence or Cure, are there opportunities to collaborate and leverage that body of evidence you've already generated over years from epidemiology and other kinds of research? Is there an opportunity for such a collaboration for non-students or for private sector?
We all know that innovation can't be a single man's job. It's a job that encourages collaborative efforts with partnerships, and that is now the ecosystem we are talking about. It can't be mainly only academia building these innovative resources without having the private sector. And it's not only the private sector, but all the different stakeholders that can come on board so that we catalyze our different efforts to be able to now come up with a product that is going to go out there and create impact. So yes, as Makerere University, and specifically from the lab where I lead, we do encourage partnerships, and partnerships in all different types of angles, all geared towards creating impact. We've previously worked with Vilbro, and it has actually supported us. So that's one good way that we are really leveraging on the collaborative efforts that come to building some of these impactful solutions. And I look forward to collaborations with everyone.
Thank you so much. Why I put that point there is that at Vilgro we found a need where most innovators don't have capacity to do research. They are focused on building the product, the technology, going to market. And with a partnership with IDRC, one of our funders, we've been able to pair the two. An innovator who has a research problem, you pair them with an academic institution that has the capacity, and they give those research outcomes back to the innovator. So I hope innovators in the room can also leverage on that. Now going back to, or coming back to Pulkit, who is going to give us a bit of an investor perspective, yeah? When you think about investing in AI, what makes you think of, what are some of the criteria that makes it feasible or a feasible investment, be it around market conditions, regulation? What are you looking at? And first of all, have you invested in any AI solution? And what are the parameters or criteria that you're looking for?
Thanks for that question, Wilfred. So at GCC, basically when we try to identify innovative solutions, especially in AI, we are looking for potential evidence for impact. So that is like a key decision-making criteria for us. And we don't want to fund any innovator or innovation that doesn't have that attributable impact on health outcomes. Even the potential for that, if that's missing, then we don't consider them, because we don't want to end up with a solution that doesn't have any potential impact. So that the attributable impact is one of the key criteria for us as an impact investor. In the past, we've invested in AI-based technologies. At proof of concept, we've invested in an innovation that is basically developing an AI-driven patient intake system in Senegal that will help in triaging patients, but also conducting like early disease detection. So that will help in reducing the burden on the frontline healthcare workers, the staff, and also drive efficiencies. But on the transition to scale side also, we've invested in an innovator called Jacaranda Health, which most of you must be familiar with. They've developed this prompt-based nudge messaging system, which is basically delivered via SMS in multiple languages. But the backbone of that is like an LLM model. So that is very interesting, and they're scaling in multiple countries now. They've served almost 2 million women in Kenya, and now entering like Ghana and Eswatini. They've also recently partnered with eHealth Africa in Nigeria. So we are seeing the outcomes of some of these investments now. But beyond that, we are also undertaking some of the other initiatives. So in Senegal, for instance, we worked with Grand Challenges Senegal to develop a call for applications focused on AI, LLM-based models that could help in improving health outcomes for populations based in West Africa or Francophone Africa. But also beyond that, we have a program on humanitarian Grand Challenges, which is a separate division within Grand Challenges Canada focused on conflict and post-conflict settings. And within that also, they're trying to see how AI can be used to deliver aid in those humanitarian settings. And they've invested in about 18 innovations that use AI ML-based technologies. But more recently, I can say that we are also looking at the nexus of digital health and climate. So how digital health tools and technologies can be leveraged to build resiliency amongst population groups that are vulnerable to climate change. So in those cases, it becomes very interesting that data science or data or AI-based predictive models can be used to predict, say, for example, cases of malaria or emerging diseases or even respiratory illnesses. So I think the potential is huge for AI ML-based technologies, but I think all of us need to be really mindful of the fact that these can also do harm. So we need to all come together to build norms and guardrails so that we can invest in solutions that are proven, that don't do any harm, and then can basically create the impact that they are intended to do.
If I am an innovator in the room, where do I get this information about the different calls that Grand Challenges Canada has put out?
Thank you, Wilfred. So I think the most easy way to do that is just follow Grand Challenges Canada on Twitter and on LinkedIn, because those are the two platforms where we publish a lot. But then I think we also have a newsletter which goes out on a monthly basis, where we release all of this information related to active and open calls for funding. So I think those are key sources where any innovator should sort of keep an eye out on, not just for Grand Challenges Canada, but for other open funding calls as well.
Thank you. I had to ask that, otherwise a lot of people will be queuing, waiting to hear for you at the end of the panel. Now I want to go back to Afya Intelligence, and you raised a very important point of 10 years of experience in AI doesn't mean it's all relevant, because AI is changing very quickly. In fact, the ones you say that the ones in college or the ones in school might have more apt skills than those who have had longer years of practicing. And I would like both you and Rose to maybe comment on, so how do we build this talent that is relevant, that is up to date, to be able to help us design these AI solutions? And this training also has to be contextually relevant, because when I did my data science AI course, I was using a lot of European, US data sets to learn. And so how do we build these AI skills using locally available data sets and making it work for a context? And I would like both of you to respond to that.
I'll start and I'll allow Dr. Ross to add. So I think the best way to do is to give the young guys opportunities to practice. So at Afya, for instance, what we are doing is we are always giving opportunities to students to come through to get practical training. Most of them actually have ended up either working for us or being hired in good positions after. Some of them ended up opening up their own companies, which is interesting as well. This is because they are able to actually, like when there is theory, but once they get the opportunity to actually practice, it really, really helps them, and also helps us overall in building that ecosystem where we have enough people who can actually implement AI in practice, rather than just theory, as Dr. Rose was mentioning earlier. So there's need for more collaboration, for it to be more intentional between academia and the fields where these skills are needed to provide these young guys with that opportunity. As Mwalim Nyerere once said, he was, of course, one of the most Pan-African leaders. He once said that for development to happen, the people must be involved. So we need to make sure that the youth have the opportunity to learn so they can actually build this nation. Thank you.
Thank you. Dr. Rose?
Thank you. So we look at this in a perspective of, if you look at training, it should be one that has a strong foundation in building the skill set of the students. And like I said earlier, it has to be backed by the practical aspects. So we do usually engage them in activities across the project lifetime, from the perspectives of the ideation of the problem to the data collection and to the building of the model aspects. You've hinted on a very critical aspect in research, which is data. But data, behind it are so many requirements. So there has to be an enabling environment to even be able to access the data, which would require instances of you have a funding for a given probably project that you're running, to undergoing all aspects of the approvals, especially where we're working with the medical field. So ethical approvals are really one of the critical aspects before you even undertake a project. So when you look at a student as an individual to be able to undertake all those barriers, that even when they have these very nice innovations, becomes very, very difficult for them to undertake such projects if, for example, they have a solution that they really want to think about. And that is where now research labs come in, because we have different programs where we can be able to formalize students to get onto the different projects that are running. I know that there are limitations also at lab level, because you only are restricted within a given project that is probably running. And that is where probably potential partners could come on board to support in that. So for the student to take up this, they are able to gain a skill set. They are able to get interface on the problem actually when we send them out in the field to interface with either the medical personnel at the different healthy facilities to understand the problems that are out there. Even that goes beyond just looking at the context of the problem they are currently looking at, but also to gain a bigger perspective. When it comes back to their academia, it's a research project done. But now when we go out, or when they leave the university, what goes out is now the innovation. How can they be able to harness the knowledge that they have gained from either a research lab or their projects that they're undertaking as students, to be able to support them when they go out there. Now that is the innovation bit. Most of our students, for example, those that are undertaking sciences, all in the practical aspects of computer science, they really lack the entrepreneurial skills. And that is, I think, where the gap is, to link what the students come out with in the different universities, to be able to even come up with their companies or startups, where whatever they have gained in an academic environment, they are able to take it out. So as academic institutions, we need to be intentional about having some of these skills integrated within the curricula, so that a student is able to go out there with this business mindset. Because when we talk about innovation, it's about changing the mindset of individuals to be able to embrace innovation, to be able to even stand up on their own and say, okay, I can be able to stand up and open up a company. And I know that begins from what are their backgrounds. Can we be able to have a training, even at lower levels, even within our laboratories, to be able to, as we integrating with students that come to us, we're able to not just build them up in the computer science ground or in the health profiles, but also to bring in that business perspective in the programs that we run, so that there is a bit of mindset change in the way they are going to, innovate out there when they leave the academia.
Thank you so much for that. I want to switch back to Sanya. I know you've implemented QAI. How many countries now?
We're in around 30 countries
30.
in Africa.
Yeah, because most of the AI innovators we work with, there's a challenge to scale from one country to another because of policy, regulatory issues. Maybe you can give us a cheat sheet about how do you navigate? I mean, I'm assuming what works in Kenya might not work in Uganda, might not work in India. How are you able to do this across 30 countries? Have you cracked a formula?
I don't think so. But I think some of the things, if I may classify that as product, policy, and people. So one, from a product point of view, I think we've really learned from different contexts and ensured that our product functions in different kind of resource settings. There are, as I was mentioning earlier, if who is the end user? Do you have the digital infrastructure? What are the dependencies? Your product should be able to work in these under-resource settings as well. I think building local capacity, trying to engage with government stakeholders, academia, understanding the local context in each country has really helped us not only figuring out what version or what form of product has to be deployed, but also what is the context, what is the local guidelines. If I may give you a quick example, if Nigeria is focusing on community-based screening, there are no doctors who go into these mobile vans or, they're actually, generally they are remote. So how do we make sure that our product is simple enough for a healthcare worker who's going there and, able to interpret what this AI output means and what is the next step for them? Versus in Kenya, when we are working with tertiary hospitals, where there are radiologists who are interpreting these test X-ray results, how do they gain value from the same product? I think we have also learned from people within these countries, figured out what the policy is, what the policy guidelines are. So that has really helped us, relying on local context. And third is also figuring out, as Dr. Rose was mentioning, we have built a very strong evidence roadmap, so which has really helped us. A lot of our evidence has also been global. We have shown how the product functions in different settings. There is independent evaluation, which has been done for our solutions, which has really helped us when we go to Kenya to say that, you know what, Stop TB partnership has done an independent evaluation of our solution in so-and-so setting. So they have a body of evidence to rely on. They also have more examples from other countries, which has helped us, navigate this.
I like that point of independent evaluation, independent studies, so that it's not Sanya blowing our own horn, but other independent people have come and said this is actually working. So thank you for that, and thank you for the, I've learned also the 3 Ps: people, product, policy. You made it up, okay. That's why you are an innovator. But then do you have, the people part, I'm not gonna let you easy. So on the people part, do you have lobbyists, do you have people lobbying in different, because even Africa itself, policy changes so vastly, so quickly from one country to the next. So the people part, how do you do it? How do you get the door opened to a policymaker, a regulator? And do you have an in-country person doing that? Just paint a picture of that for us.
Yeah, so we have both in-country team members and team members globally from other countries as well. We have, of course, there are regulatory, pathways, guidelines in each of these countries. So we have a regulatory team which follows what are the laws, each of this country. So that is like going by the book is the first step. That doesn't guarantee or ensure that, if you have a regulatory approval in one of these countries, that you can go and implement at scale. So I think getting the compliances in place, doing pilots, having evidence in those countries, and then of course I will not say that lobbying, but also engaging with different stakeholders. So we don't go and talk about this is the AI solution, this is how you can deploy. We go 3 steps before, saying that what are the challenges you are struggling with in the TB space, right? If you are thinking about AI, we are very happy to do like a brown bag for you. So if you have to consider AI, ask these questions from technical partners. Ask them about data privacy. So we also do that knowledge gap bridging before we go and, say that, yes, this is also a solution which can work, which really helps in building that trust with government stakeholders and implementation partners, because now when they are saying yes to this solution, they understand more about it. This solution is not a black box, but they feel more comfortable in making these decisions.
So essentially, don't talk about the product, talk about the problem.
Yes.
I'm going to come back now to Pulkit to tell us a bit about, in the morning plenary you heard from Emmanuel about the status of health tech investment. And what are some of the barriers to investment? Why are we not doing as much as fintech 10 times? What are the challenges that you face as an investor?
Yeah, I think some of the points which Sanya mentioned were around compliance with regulatory frameworks is a challenge. I think the AI technology in itself is developing so fast, the regulation is not able to keep up, match up to that space. So I think that alignment needs to happen, and then compliance with things like data storage, data privacy, patient privacy, safe storage of information. All of these are important things because you're dealing with very sensitive information. More recently, we are also starting to think about how usage of AI technologies has an impact on climate. What is the carbon footprint that it's leaving? So those kinds of things are things that we will always study before making investment decisions. But I do want to be a little bit humble about how we are assessing, like investors' ability to assess these tools and technologies. And I think even we are not there yet to understand what is novel, what is bold, how is any particular AI technology better than any of the existing approaches. So we have to rely on experts, we have to rely on government stakeholders and other experts to really understand the novelty factor, but also understand what are the opportunities and challenges and harm that any technology can create. So we are in the process of learning how to analyze these types of technologies and collaborating with different stakeholders to vet these. But I do want to also talk a little bit about from the perspective of supply side of the innovation. So we put out a call for application for specifically centered around LLM-based technologies in Senegal, focused on West Africa and Francophone Africa. And we received only about 75 applications. Out of the 75, only 40 of them were eligible to proceed further. So what I'm trying to say is like the supply side is also not there yet in low resource settings. So the market is still nascent and still needs to develop. So hopefully, as the regulatory landscape develops, as we see more and more innovations coming out of, say, East Africa or Central Africa, we'll see a lot of stimulation happening in West Africa and Francophone Africa as well. But yeah, those are some of the barriers which investors have to sort of grapple with. But then the opportunity here for us is that we continue to collaborate and engage with diverse set of stakeholders, meet with them to understand what is the potential, and then make joint investment decisions.
Thank you, Pulkit. So innovators in the room, you've heard that Pulkit is not getting pipeline, so we need to do something. Are you getting in your applications, or do you need help putting in quality applications? Because sometimes I think it's about the language and how you package, which might disqualify you. But that's a good problem to have, that we are looking for pipeline, and I can join Pulkit because we also invest, and we are looking for innovators to apply. And sometimes we are willing to help you as an innovator to actually put in a strong application. Before I open up for Q&A, that empty seat on the left was for the policy regulators. So I'm going to give 1 minute to each of the panelists to say one thing that you'd wish the regulator or policymaker does to make your life easier, either as an innovator, as an investor, as academician. What is one thing you'd like the policymakers in the room, especially now that we just launched the policy blueprint at the HealthTech Hub Africa, which is available on the website, by the way. What are some new things you'd like us to include even in that policy brief? So addressing it to the hot seat far left of policymakers. In any order.
So from my perspective as an academician is that we've seen and from experience that we are developing all these solutions in-house and ad hocly. because the whole idea of developing all these solutions is to have them impact the societies that we're developing the solutions for. If I'm developing a medical solution, it's because I want it to impact patient outcomes. Currently, I know that different initiatives have undertaken on developing policies that are to create an enabling environment to have innovations integrated into the medical facilities. But at country level, I think that is some of the conversations that we need to engage in. Because without an enabling policy, without regulations, which could provide us checklists and guidelines, we acting in a limbo. So I would urge you, policymakers, and I think this is a call upon at government level, to provide that enabling environment so that researchers and innovators can thrive and have innovations that are out there to create impact. We've created evidence, but we need to see that evidence touching the people out there to change their lives.
Thank you, Dr. Rose. Harrison?
Yeah, thanks. First of all, I would like to appreciate first the Tanzanian government for accommodating Afya Intelligence in this space and being able to work with them. We have had the privilege of accessing data from the public health systems and in results being able to develop the solutions that we think are going to have great impact in Tanzania, but also across Africa, because the systems are very similar. The public health system, especially the supply chains, are very similar across countries. Even the technologies that are currently being used are pretty similar. So whatever we are developing in Tanzania has potential to be plugged into the other countries once we get there. So I would like to appreciate that, but also to appreciate our partners. So I think something that has helped us to succeed is also leveraging partnerships. So working, some of the contracts that we have are through implementing partners that have traditionally been supporting the government in those areas. So that has really helped us in bridging that gap, and then getting now to that level of now having MOUs with the ministry. Also appreciating like HealthTech Hub and other accelerators and other partners who are helping us in building that trust. I'll give you a good example of something that was asked of us, is that maybe hosts, that conversation that we had about cloud and local hosting. So as a startup, sometimes you don't have even the infrastructure, for instance. Even if, first of all, cloud is better performance, but also like the resources to actually do it and have enough infrastructure to do that kind of work is not, we don't have that access. So I could practice better and it's cheaper to use cloud sometimes, even, or even it's a requirement to do that. But those are conversations that I am happy I've had here, and they'll continue. And I've seen it also even in the blueprint that we are working, some guidance which the governments can look at and see how they can be more accommodating towards these new technologies, which sometimes, if you want them to be accessed by the clients, you want visibility across, for instance, for supply chains, it's like you want all stakeholders to have visibility, so you don't want silos. So you always want web as much as possible rather than a siloed system. So for policymakers is, I think, requesting them to allow more dialogue. For innovators, I think it's more of finding critical problems that really resonate with the ministry. We know, like, when we started and now we are able to speak to the needs. So making sure that you have a use case that's really addressing the critical issues of the government. Like we know, for instance, budgets are issues with the government. If you are going to solve that issue, then they will be willing to talk to you and find ways of accommodating some of the issues. Thanks.
Thank you. And I'm aware that TMDA in Tanzania is actually leading the way when it comes to AI regulations. So if you're an innovator and you want to scale to Tanzania, you should get hold of Harrison after the panel. Likewise, also, if you are trying to scale to Uganda, Dr. Rose would also be happy to handhold and introduce you to the different regulators. Pulkit?
I think I'm just going to maybe reiterate what I said earlier. I think the speed at which government is coming up with regulation needs to be a lot faster because the technology is evolving at a much faster rate. So if you want to harness the benefits of AI, then put in place proper principles and norms that will help all of the innovators to develop solutions within that framework, but also use it in a very do no harm kind of responsibly, but also in a do no harm kind of way. And then the other thing I think which you sort of were alluding to, Harrison, was translating those principles into action. So working very closely with key stakeholders to translate those norms, principles into action. I think some of that work, Joanne, you're leading with the policy blueprint, taking that principle into action. So I think that's something which is really required.
Thank you. And that's a very good point. Most of the time, regulators are playing catch up with the technology. So I think we should be a place where we are almost at par. And I think we also have a role to play as innovators to educate regulators to bring them up to speed with the latest developments. I think that's all on us to do. Yeah, thank you. Sanya?
I think 2 points. One is if we have a one-stop, all-hands platform, right? We have representatives from academia, representatives from funders, representatives from Ministry of Health, all these different government bodies who are involved in implementation at one place. And that helps in faster decision making and ensuring that all perspectives are, incorporated when we are taking these decisions. So that is something which is very, very, which will really make things much faster. Also alluding to the speed and the responsibility of the government. It should match the way innovation is actually progressing in the health tech ecosystem.
Thank you. Now I want to open up the floor to I don't know whether we have enough roving mics, so we have one hand up there, a second one there, and the third one. Let's take those three for now. The gentleman behind.
Thank you very much for a very fantastic panel. That was really, really good. My question goes to Dr. Rosand Pulkit. It's about the role of science in both on the input side and on the output side of what you do. Specifically, we know that there's I would say, knowledge or a capability gap between the more advanced countries in implementing artificial intelligence and our countries here. And so that also has an effect on the output side in terms of the publications that are coming out from Africa in AI. But it's not just the AI on the tech side, where you're looking at the data and the algorithms, the loss functions, and all those technical pieces. But you're also looking on the input side, a place like healthcare, where it's core biomedical science, anatomy, physiology, and all the other things you look at. And so my question is how, on the input side, you're helping the innovators be able to make sense of the science that actually drives the algorithms and the methodologies that you're going to use, because there are multiple methodologies you could use, and you need to be able to evaluate to determine which one is the best fit and gives you the best output. So that's the input side. And on the output side too, how are we collaborating internally here in Africa and, say, for example, with universities in Canada that are able to share some of their expertise so that we are not only increasing the level of the output, but also the quantity and the quality of research output in AI. Thank you.
Thank you. We'll take the other two more questions before. So the gentleman behind, and we have one gentleman on this side.
Right. Thank you very much. My name is Dushime Jackson, and I'm a public health professional. I have a question. We normally know that we have a shortage of health practitioners in Africa, and I'm wondering how do we keep the health practitioners updated about these technologies that we are producing, because they have a lot of work, they don't have time to go and learn by themselves. So what are we doing so that we produce the technologies that are going to be used, not just be the buzzword, but be used at the health facilities? Thank you.
Thank you. One behind there.
Right, thank you very much. My name is Nimzing. Sometimes I feel like I'm eccentric because I became a consultant medical doctor in Nigeria, moved over to the UK, and based on problems I identified when I worked in Nigeria, in liver cancer, I decided to do something about metabolomics to identify biomarkers in urine for diagnosis. That was published very highly, and I wanted to get it down to get it functional in Africa, because they don't need that much solution in the UK or US. And then I'm asking this question because I looked at the Grand Challenges website, and it definitely excludes me from participating, for example, because I feel like, okay, I want to give back, but I can't, because my solutions cannot get into the competition, for example. Whereas I could actually collaborate with people back home. And then I think someone talked about research based on people in diaspora and how well we can be integrated into the Africa health systems. I'm not sure we have such platforms. How can you help us? Must we come back and stay here to make impact? Thank you.
Thank you. So we'll take those three first, and then next round we'll start with the lady there. So let's go with the first question, which was Dr. Rose and Pulkit.
He asked about the role of science, and I think this is the role of science in creating evidence for Africa, and more to it inclined to a solution that is for the Africans. How we're trying to do it is, we know that, of course, in the US there are pretty much advanced solutions. But when you to look at, from even the data, the way it's collected, to the models that are being developed, and if you just to import such a solution and then dump it in a different context, from experience, that has always created different results. So what we've embarked on is that, can we be able to create and generate evidence and science that is contextual, an AI solution or a technological solution that is going to be able to serve and look at the problems that are within Africa and then create solutions around that. We know that Africa is a very unique continent with its opportunities and challenges. And in the way we formulate some of the projects and solutions that we are looking at, we have to be very, very intentional about looking at the context, where the problem is, and what technological solution is going to fit within that context. And that is where we begin from to create evidence. When you look at the infrastructural barriers, and I think that will create a very good understanding of this, is that you'd realize that in some of the remote facilities, we sometimes don't have internet connectivity over there. We sometimes don't have electricity in those environments. So then, if we to think about a solution that is going to lie impactful in such an environment, then it should be one that is going to fit within that context. So we know and very much appreciate that the solutions out there in the US create a backbone for us to understand, for example, the science behind artificial intelligence, but when it comes to creating solutions that are within our context, we have to rely on data from the African context so that we build evidence around that, understand the problem and the kind of environment that we're operating in, and that is how we're going to be able to create a solution that is going to match the certain context that we're talking about. If you to bring up a diagnostic solution, for example, that is going to support malaria diagnosis, as much as we're looking at the accuracies of the model at the end of the day, but then we have to come back home and think about what mechanism am I going to use that is going to fit to have a solution that is going to be applied remotely. And that is where I get back to now, what are the available equipment that are low cost? So the solution should be tailored to fit that particular context, but providing a solution at the end of that day. Yeah. So we really think about the technologies that we build to serve the kind of environments and contexts. And then collaboratively, of course, we work with universities out. For example, on one of the projects, we're collaborating with Boston University to support on skill set development where we lack enough, because we know that artificial intelligence is one of the new technologies in our context. So we collaborate with other universities outside, but evidence always has to be home-based, because that's where the impact will now come from.
Thank you. I'm seeing time is running out, so Pulkit, I would ask you answer the gentleman who asked about funding. And then the innovators can respond on that question of, beyond the buzzword, how do we engage the professionals?
Thank you so much, Dr. Rose. I think just building off of that very quickly, so we do fund like proof of concept stage solutions on the input side, just to help local innovators demonstrate evidence, which is like contextually relevant. So that's our whole intention. We don't want projects or solutions from high-income countries to parachute into these African contexts and not be applicable here or not solve the purpose. So that's the reason why we have like proof of concept stage funding as well. And then to you, I really apologize if like that exclusion is not our intention at all, but we are mindful of making sure that the innovations or the innovators we fund are locally grounded. Like even if you're like based in another geography, maybe a high-income country, if you have like a local team or local collaborators that you want to sort of work with, then that is something that we're definitely open to considering. But the emphasis is on localization, where local stakeholders own and run with what they want to do, because they understand the problem more closely, and they should be the owners of solving that problem. We are just facilitators, and we can help make things happen. So if you have anything that you would like to like propose and discuss, we're happy to do that.
Thank you. So maybe Harrison, you want to take the one on going beyond buzzwords, and how do we engage healthcare professionals in this journey?
Yeah, so I've also been a culprit of like going with the buzzword AI and all, and trying to do all, like taking the solution, like starting from a supply side and trying to take it to the users, but learned over time that you really have to start the other way. Start with the users, understand them, understand the critical problem, actually the immediate problem. As adults, actually adults learn or use something that has immediate application. So for these healthcare workers who are already overworked, so if you're taking a digital solution to them, make sure that it has immediate benefits for them, that again, it's really going to help them there. Otherwise, you spend a lot of time training them, applying different like change management issues to try and convince them to use the solution. So we learned that, and the current solution, for instance, that we are currently providing, we were at a summit like this in Tanzania, the Tanzania Health Summit, a few weeks ago, and we were doing a demo, and some of the healthcare workers were passing there, and so like they could see us like, how come I've never seen this and it's not in my hands now. We ended up onboarding more than 20 users, because once they saw it, they went and looked for others there to make sure that they came there and got registered and started using the solution. So that came because of the work that we've been doing with our partners who helped us to access healthcare facilities and health management teams, to sit with them, understand the problems, and then design from there. So beyond the buzzwords, it's like seeing what's possible with the technology, but really finding out what is the issue and trying to solve it. Thank you.
Thank you. So we're going to take one last question from the lady. Just last one, because we didn't get any lady, and then we... there's a lady who had her hand up, and that will be the last question as we close the panel.
Okay, thank you so much for giving me the opportunity. My name is Nambugo Noreat. I come from Uganda. I'm an innovator, but we also run an innovation hub at Mbara University called HealthTech Uganda in health. So my question goes to Dr. Rose. My first question is, as someone who is into academia, what have you done about, because the courses under your faculty, I think there are technical courses where a student is required to come up with a project, but the drop rate is high. Most students will drop the projects immediately they graduate or even before graduation, yet they are very good ideas. What have you done about it? Then the last, your last question, I think, to the panelists was about was about the regulators. So as innovators, I'm thinking we have some regulators here. Our humble request, we are all from Africa, is can you look at innovators as young people who have not had a lot of money, experience, and also experience? So if an innovator is trying to run a clinical trial, because we are in health, we are innovating in health, and you're asking them to pay, for example, $5,000 for insurance, I mean, that's a lot of money, and there is no funder. There are many funders who will say no to that. So that means as an innovator, you have to find a way of looking for that money so that you get allowed to carry out clinical trials for your innovation. The other one is tax holidays. I mean, the moment I get into the market and then you're putting me at the same weighing scale as someone who has been in business for years and years, you end up killing the innovation spirit, because I'm not going to survive in the market. So my humble request is for us to look at these innovators as people who are trying to provide a solution to our, to Africa, so they should be supported by our governments. Yes, we need the funders to come in and support us, but I think also our governments should play a role in making sure that these solutions are pushed out into the market. Thank you.
Thank you. We'll only let Dr. Rose to answer, and then we close the panel. We are available to engage with you outside or during lunch, so please grab hold of any panelist here if you have other questions. So Dr. Rose.
Thank you very much for that question, and it's one that keeps grappling on our minds on how to really sustain students through the programs. Remember, this is a university that has its structures and ways of how they bring in the students, because when you look at the undergraduate level, there we think that a student is purely funded. If they don't have a scholarship, then they're the ones to actually find funding for that. Then when it gets to graduate levels, that is at master's level, PhD level, and postdoc level, there again the student is actually engaged in core research. Sometimes again those students come with a scholarship on top of that, which is able to actually take them through this research process of the different work streams they are working on. All, again, they are going to privately sponsor that. And I think that's where now the laboratories come in to fix a problem, not permanently, but temporarily, because we also run on the basis of projects. So we're being deliberate and intentional on, for most of the projects that we take on in a university, there has to be a component of capacity building, but then that is again within the confines of a given project and what it can be able to support. So it's not 100% supportive of every student. Usually we take on from the graduate level, and those are the ones that are at master's and PhD and postdoc. For the undergraduate students, they usually take up what we call internship, and those are again streamline and go into the pipeline for them to finish their projects. So the call out on this, which is actually a very major concern, is that how can we be able to sustain at project level the students that come within our conference to be able to mentor, but again, to mentor them beyond the university level, and I think that's the major hurdle we have to, cross. In ways we have been doing this is that we are engaging with partners to be able to support us beyond the lifetime of a given scholarship, for example. But again, this is an outcry to development partners to have, a very formidable solution where we can be able to take on students and probably build like a pod where they can be able to, innovatively come up with solutions that can go out to scale. In Uganda currently, through the Ministry of Science and Technology, I know there is an initiative that is out there looking for startup companies to support these innovations. That at the university level, we've not yet realized it, but I think as an institution, and I know at management level, we really need to advocate for that, to have a kind of sustainability process where students can be able to engage further. And I know that the concern came in from usually the high dropouts. Now, those are the students who cannot be able to, are private sponsored students, first of all, coming from sometimes poor backgrounds, but also sometimes cannot make it to the projects that are running within the labs. So that's where the big hurdle is, and that is the biggest number. It's a very big concern, but needs a timely intervention.
Yeah,
and
thank
I'm
you.
Glad you highlighted it.
Thank you, Dr. Ross. I know we've gone slightly over time. Sorry to cut you short, but we can continue with this over lunch. Join me in appreciating our wonderful panelists this afternoon. And looking forward to more interactions outside of our lunch. Thank you all for coming.